I just can't phone this with the video right now.
Yeah.
See.
I just was like, I felt bad because she was the office and short, so I was like, I at least wanted to get her, like, paid
If
done if we could.
we disabled her, it's
Hello?
because she said we were told she's not working here anymore. So, yeah.
Because I know, like, once they told us she's willing to come in and, like, work with us, and start figuring out.
Don't
like,
like DPS that, like she was done, like our personnel, I don't, because you don't have to say when somebody's done, they're just done. You're supposed to re-up people every July 1, but I don't think that happens.
Okay.
In general.
So we want her, is that,
Yeah.
maybe she doesn't want to, but we want her.
I already told her, I was like,
Is, Doug Major, wait, no, that's Majors.
Yes, so can I talk about that real quick, just because I need to send this
you
email?
know, you know, yeah.
No.
Okay.
Okay.
Go ahead.
Did you see the email? He's the one that's gonna do the public comment.
Oh, is that the,
It seems, I know.
is that the lazy eye guy?
Yeah.
Okay.
So he seems like it's just normal, right? I mean, he really associates himself with First Five San Luis Obispo, so I hope that they're okay and they know and,
So, but he knows who's on that.
yeah. I will,
Jamie, do you want to bring your stuff up?
he said mute.
Wait, what?
He said mute.
Oh, crap.
Days ago, actually, I think it was Sunday afternoon, I received an email from the governor's office saying that he was asking all state offices to close at 3 o'clock on Monday, Tuesday, and Wednesday in order to help save energy, to help with rolling blackouts. So we are really going to be jolly on the spot with our meeting and end by 3 today, so we can adhere to what we're being asked to do. So with that, I'll turn it over to George to get the meeting started. Good morning, George.
Good morning. Good morning. Yeah, the temperatures in Sacramento are just ungodly. I can't even imagine how you're putting up with it. So thanks for doing that. I will call the meeting to order and we will do the roll call.
Jamie?
You're away, Jamie.
Member Alvarez?
Here to, yep.
Here.
Yeah.
Montu Davis. Monica Fitzgerald.
Here.
George Halverson,
Here,
Anna Hazen,
Here.
Molly Munger.
I don't know why I'm not showing up on the screen, but I am here.
good.
Okay, great. Jackie Majors,
I'm here.
Perry.
Here.
Okay, George, everybody is present and accounted for, I think, who's going to be here.
Excellent, excellent. I'm going to make a couple of comments at the beginning of the meeting for context, and then we will roll into the rest of the agenda. First of all, I'd like to thank people for feedback. I asked at the last meeting, last couple of meetings, but the last meeting for some feedback on some issues and on some presentation approaches, and I got some wonderful, wonderful feedback. I got a couple of great
They're
notes.
not on the screen for some reason.
What's not on the screen?
Oh, I'm sorry. I'm gonna mute myself. We're having a little technical difficulty. I'm gonna mute. Here I go.
Okay. Anyway, so I had great feedback, much appreciated. And one of the things that I heard in a couple of them was that I had sort of fallen into a deficit approach or deficit focused way of teeing up and describing some of the issues. And I thought it might be useful for context to talk a little bit about some, again, context points. On the deficit thinking, I actually spent a number of years at Kaiser Permanente. And Kaiser Permanente, we made diversity into a major asset. We celebrated it, we worked to achieve it, we made it into a resource. And when I left, we grew the company on my watch from $20 billion to $50 billion. So the growth was significant. And when I left, we had 59% of our employees were minority. So we are the same as the birth rate in California. We got to 59% minority. And the senior executives were overwhelmingly minority. The leadership group, we had 8 regional presidents for the 8 Kaiser regions, and only 2 were white males. And those 2 were not large regions. And so we had great leadership at the president level. We had great leadership at operations level. My CFO, woman, brilliant, great job. And so we celebrated, and my COO, who replaced me as the president and chair, was African American. So I succeeded by an African American. He unfortunately died unexpectedly, and he was replaced just now by Greg Adams, who was a group president whilst I was there, and he's also African American. So some of the newspapers said that this is the first time that a $50 billion company in America has had an African American CEO move on and be replaced by another African American. So that was kind of a historic thing. And how did we do as a diverse organization? And that's my point. We were the best at everything. Diversity is a huge asset. We were number 1 in JD Powers. We were number 1 in Consumer Reports. We were number 1 in Medicare. Medicare rated 400 plans in the country, and only 11 of them were given 5 stars, and 8 of them were Kaiser Permanente plans, regions. So we had the very best outcomes. We were the first hospital system in America to open to gay, lesbian partners as full status, and we shamed other hospitals into following us down that path. But we were very, very, very diverse organization, and our diversity made us strong and creative and cooperative and collaborative. And we had tons and tons of good things going because of that diversity. And that's what I desperately want for the state of California. And I want California to have that same kind of success that Kaiser had. And we're not going to have that kind of success for the state if 60% of our Hispanic kids and 60% of African American kids can't read. I mean, we cannot get to excellence. We set goals at Kaiser and everything. We set goals on patient safety. We actually got the patient safety levels to the best in the country. Every other hospitals have 20% of the old patients with pressure ulcers. We got it down to 5% or 2% with a combination of culture. We had 6 hospitals here that did not have one single pressure ulcer. And that's because very diverse patient base was treated by an even more diverse caregiver base. And they treated all the patients with the very best possible approaches. So the model works. And when I look at California, and I look at all these kids who can't read, it makes me crazy because I know we couldn't get upstream in that process, and we could set some goals and we could do some things to be transformational in that process. And we could get to the brain development of those kids early on. And when I look at an issue like books, I don't think of books as being a magical thing. I look at the fact that these homes, right now, COVID homes, isolation, these are really tough places to be. They don't have enough food, they don't have enough money. A lot of the families are in really tough shape. There's a lot of stress, some anger. And what we need in those settings is as many joys as we can convey, and we need serve and return sorts of interactions. And the very best tool that we know of from all of the science and all of literature and to create serve and return reactions is books. Because if you get books into the setting of a parent, you don't have to teach them. What you basically need to do is make the book available, and you get reading, you get interaction, you get feedback, you get a loving interaction that gets security for the kids, and we know that it improves the morale significantly of the mothers. So the reason I'm talking about books a lot is not that I want to do something magical, and I think there's, drop books in and all of a sudden things will get better. It's because these homes are in so much pain and so much difficulty and so much poverty that we need to put some joy into those settings. And you all know how much joy books gave you and how much joy gives your kids if you've got kids. And we need to, and when we look at the equity issues and we look at the fact that the average white family in California has 12 to 20 books, and over half of the Medicaid families do not have a single book, the equity issues there all by itself are painful. And so that's why I'm on the track I'm on. And it's not that I'm looking at this from a deficit approach. The exact opposite of it. I want California to be beyond deficit and to thrive and prosper. And I want every single kid to have a chance to blossom. And I believe all of these kids can blossom if we give them the right support. And I believe we owe it to them to get their support, which is why we need to set literacy goals for the state. And I'll kind of end with that. And I'm asking Chris to jump in on this one. We cannot improve the literacy levels if we don't set some goals on a couple of key things. KP, we got the pressure ulcers down to nothing. We got the sepsis death rate down to the lowest in the world by setting goals and then putting processes in place to get there. We need to do the same thing. We need to have books in 80% of all the low-income homes as a goal. And then we need to have people reading in those homes as a goal, and just make that kind of the learning starter set and make that happen. And we've got on board at KP and other settings, we bring people together who are fellow believers who really want to make things happen together. And they will do a magical, wonderful, creative, innovative things. And we need to do that with literacy. We need to make this a literacy agenda for the state. Chris Five should lead it. The state librarian's on board. The superintendent of schools is on board. They both said they would be very, very happy to be part of that team. And I'm moving on. So I will say really quickly, when I got to KP, when I got to First Five, I set goals for a living, and I set goals because it's who I am. And so I set a couple of goals. And the very first goal I set, it was that we hadn't taken a stand on any legislative issues in a couple of years. So I said, we're going to take stands on 90% of the issues at the legislature. We hired great staff, put together some good people. I went over and I met with all the key legislative leaders. I met with committees. I did a bunch of stuff to get that pump primed. Then I got out of the way, turned it over to great staff, and they did a great job. And so we got to the 90% goal there. 90% goal on parents is we wanted the Talk Read Sync campaign to be recognized by 90% of the parents. We had 10% recognition. We actually got to 87%, so we get very close to the 90% on that. Wanted 90% of the homes to have books, and we got partway down that path, and we're using Little by Little as a toolkit from LA. They're doing a great job in their setting of achieving that goal. We ran out of funding on that and didn't extend it to where, so we're falling behind on that one. And our website, I spent a lot of time working on the early versions. The KP website and the Mayo website that I both worked on are really cool websites. Great interaction. We put some of those same points into the First Five website. You're going to love it when you see it. But we did that back when I could do deep dives into that process before Chris changed the committee structure. So I couldn't go to those meetings and do that kind of work anymore. But we actually made a lot of progress on the website, and that's going to be a good place. But the last place we need you as commissioners in front of the public. And we need the last 90% goal is we need the news media to call 90% of the media, newspapers and TV, to call and get First Five commissioners to go on camera and in front of, to talk about learning gaps and what we're doing in Cal, because the learning gap story is going to run again every year. It's an annual story and it gets worse every year. And they've had no good news in that story. So we need to put some good news into that story. What we need, Jackie Majors just did a great job with the media. We've had a couple of the commissioners who've done a great job with media. We need you guys on board with those stories, talking about teaching and getting the media on board. And we can do that as part of the next, so that whoever succeeds me as chair can go down that 90% will hand over to somebody else. But that's the context. And I want people to have a sense of that, because I've not been ever accused of doing deficit thinking before. And when two separate commissioners told me I was doing deficit thinking, I thought, okay, I can't ignore that. Thank you. That it was, because I clearly had flipped to the wrong pattern and the wrong approach and I really appreciate the feedback. So with that, unless there are some questions, I will move to our agenda for today's meeting. What do you think? Any quick comment? All right.
See you, George.
All right, Camille.
Okay,
Let's go to the agenda item.
great. So moving forward, just before we go any further, just talking to not commissioners, but to the public who are there, if you would please put your full name into your Zoom, just so when we call on people, we have a little bit better idea. If there's 7 Marcias, it's hard to figure out who goes when. So if you'll do us a favor and put your full name, that would be so helpful. So that is what I was told to do, to ask. George, do you want to read the conflict of interest?
Yeah, for some reason I have lost the public conflict of interest statement. Let me go back to that.
It's, I think on page 2 of your annotated.
Okay, consent calendar. Members of the public may speak. Huh, do I not have the conflict? Do you have it in front of you, Camille?
Yeah, I'm happy to read it.
I think you can read it. Why don't you just read it?
Okay, conflict of interest. Will you please let the chair know now if any agenda item presents or potentially may present a conflict of interest for you? Obtaining this information in advance will ensure that he can announce your non-participation in any aspect of that item in compliance with applicable laws. So does anyone have a conflict of interest at the moment? Well, not at the moment, at all.
Any conflicts at all? I found this statement. Yeah, any conflicts? Great, all right. If not, let's
Okay.
go to First Five California Executive Director Report.
Yep.
Take it away.
Great. Perfect. Thanks so much. As I said, we're really going to try to keep this meeting moving. And so I'm going to keep my remarks hopefully short and to the point, and we will follow up with an email to all of you for things that we think maybe could have waited, and just to give you updates on where we are with certain things. So we'll be doing that. First of all, just to give you, we've been talking at the budget retreats a little bit about staffing, about you know, where we are with that, and so wanted to tell you we're pleased to share that internally that Lakshmi Warajada, who works for us, recently was promoted to an ed programs consultant. Very excited. Lakshmi oversees the dual language learner pilot evaluation, and she works as a liaison with counties, among a million other things. So we're very happy for her. She's really doing a terrific job. If you'll recall, our personnel liaison, Kathy Ellis, retired a month or so ago, and so we've hired a new personnel liaison named Corey Hudson. You might hear from her occasionally. So she came to us from CAL FIRE, where she administered contracts, drafting policies, and provided personnel services, all a skill set that we can use here at First Five California, where she's gotten off to a great start. It's our first hire that has come in virtually. So it's a new experience to hire someone and you know, never see them until only virtually. So, but she's on board, she's doing a great job, and we're very excited for that. We're also in the final, stages of interviewing staff for our contracts office, for the evaluation office, and the administrative office. So all that is to say, we're moving along in those processes and hoping to fill out our team a bit to relieve a little bit of workload from people who are doing multiple jobs at the moment. Back to George mentioned in his opening comments, serve and return and the power of that. We're going to be sending out commissioners some information. I have it, I just need to get it in an email to you that talk about serve and return and just remind us of the importance of that from the moment they're born and watching those little feet kick and arms wave and to where they get old enough where they can actually return it right back to you. I live with an 8th grader. Yes, let me just say that gets better as they get older. So, but really about the power of serve and return. So you'll be seeing that information coming to you this way, hopefully in the next day or two, but we have that for you. Just to bring you up to speed on a couple of things. The first is Impact and Impact 2020, where we are with that. Good news is, again, all 58 counties are participating. Locally, grantees continue to support COVID response and recovery by helping childcare providers keep their doors open and connecting families and children to services. We're excited about that. Internal staff, with the input from staff at the Department of Education, are hard at work creating a new Quality Counts California reporting portal. So our IT department has been working like crazy and coordinating with program staff actually for months to create this web-based system that will streamline the reporting process both internally and for counties, and we plan to launch that this fall. Again, it's probably not the sexy stuff that we all like to see, but it is critical for us to get our work done, hopefully in a streamlined way, making it easier for people who are doing this work to report. So we're very excited about that. Later, you'll see, as you've seen on the agenda, we'll be revisiting a couple of new projects. We propose to fund with existing Impact 2020 allocations, and those projects are priorities for the administration. They'll support COVID recovery efforts and will improve quality, which is one of the primary goals of Impact 2020. And those are the projects of shared services and new content for the professional development website. So you'll hear about those in just a little bit. George talked a little bit about books, and we just want to tell you that we're moving along with our book distribution program. If you'll recall, the commission gave us direction to use some of the Fraser money that could be repurposed because we weren't going out and about to use that for books. And so we have been working on that. Counties have, we've been working with our county partners. They've submitted letters of intent to participate with us in a book distribution, and we have so far. The deadline was last night at midnight. We have 42 counties who will partner with us to distribute more than 500,000 books to kids and families. So we feel good about that. We're working through a few channels to maximize the number of books distributed. 50,000 books have been purchased from Scholastic already and will be packaged in sets of 3 and shipped to county lead agencies. Now that we know, we're going to put out a very simple application within the next couple of weeks and find out who that lead agency is and get the books to them. In addition, Fraser Communications worked with Lexis to obtain a donation of 2,000 books to add to our total, which is a great example of a public-private partnership, of which we hope we can build upon and get others to do that. We're also coordinating with the Dollywood Foundation, and they have been graciously flexible to allow us to work with them on a book infusion, which is different from their traditional model. They've done this work with a couple of other states, and so we will be working with them so that counties have a little flexibility in how they choose to distribute these books and what to use. We're grateful to have already built some partnerships. We're going to keep you posted as the books go out the door to families and children around the state. We have had conversations with our counties about the selection of titles, ensuring that we have bilingual books, we have books only in Spanish, that we have books that represent the diversity of our state. And the counties are putting together a small work group just to make sure that they are working with us on title selection. So we're doing that. So that's where we are with books. Excited about that. We are going forward. Wanted you to know that. On the home visiting front, if you'll recall, in May, First 5 California released a request for application for home visiting coordination. Commissioners approved the home visiting coordination funding in October of 19. It is designed to promote cross-agency coordination of home visiting programs and worked to embed home visiting as an essential component within other child development and family support systems. Due to the pandemic, we pivoted the focus on home visiting coordination and integration to support families through COVID-19 recovery. 51 counties are participating in this funding opportunity, and we are working right now to complete their contracts. Dual language learner pilot study, the American Institute of Research data collection was impacted by COVID-19 pandemic after many schools and centers closed in mid-March. AIR modified data collection for the second in-depth phase of the study. It was fall 2019 to spring 2020 to accommodate these COVID-19 impacts. They added new questions to the surveys We expect to have preliminary findings about the impact of the pandemic this winter. Of course, we will be sharing them with you. We are very excited. We've now released the RFA for the expansion phase of the study on July 3rd. The expansion phase funding is available to the original 16 counties that participated in the in-depth phase. We will be looking for that to really help us learn about scalable and sustainable practices and focus on supporting children, families, and providers serving young dual language learners during the pandemic and through the COVID recovery. Counties expect to reach more than 20,000 dual language learner families through messaging and family engagement strategies, including distributing books, and improve the skills of more than 10,000 early childhood educators who serve dual language learners. So we're excited for this work to begin and to share that with you at a future meeting. For the small population county funding augmentation, we have a work group of 7 small population county executive directors, along with the leadership of First 5 California, the First 5 Association, and the counties have asked, the small counties have asked First 5 Los Angeles to join them and be the voice of a larger county. They have in the past always had someone from a larger county. This time they took advantage of the largest. So the executive director, Kim Belche, is working with us as well to discuss the next round of funding for small counties. In preparation for the conversation, Child Trends completed interviews with the 20 smallest counties about their successes, their challenges, and lessons learned, and summarized these in a report. If you'll recall, we shared this report with you in a recent email, and it is available on our website for the public as well. The current augmentation funding will expire in June 2021. We anticipate bringing to you an information item around this in October with a more concrete proposal in January 2021. Just to update you finally on the emergency supplies, we wanted you to know we're still out there getting emergency supplies to folks, working with our contractor, supplybank.org. So we currently have distributed to all 58 counties the following emergency supplies: 1.2 million adult masks, 150,000 child masks, 4.9 million diapers. That's a lot of diapers, I think. 75,000 baby wipes, 30,000 units of all-purpose cleaner, 68,000 units of disinfectant solution, 30,000 units of disinfectant spray, 60,000 units of hand sanitizer, 114,000 units of hand soap, 3.1 million surgical gloves, and 63,000 books. So a lot is going out with the remaining funds. Yeah.
Quick question. Did we have in that mix those thermometers?
Yeah, they're coming up, George.
Okay.
With the remaining funds that were approved by the commission in May, we'll be doing additional supplies, including masks, hand sanitizer, disinfectant spray, disinfectant wipes, and First 5 sponsored touchless thermometers. So which will be distributed to counties beginning in September. So those items were selected because we did another survey with the counties, and those were the top of the list. So folks will see thermometers that actually say First 5 California, those instant thermometers. I think we showed them to you last time, and they'll start September. So we
told a couple of media people that we were going to be doing to the high need families, the essential worker families, that we were going to be providing those little thermometers. And they said, holy cow, that is absolutely spectacular. the double, triple use you get, not only is it good for the kid, but it's also if these are essential workers, it lets the essential workers get back to work and be safe and whatever. And I said, yes. And I said, when you're ready to talk about that, let's talk about it, because it's really a cool story. And it really makes the point when we do diapers, diapers don't get to the front page of the paper, but the thermometers have the potential to be, so hold on, we should do a story on that at some point. You or somebody should be
Right.
getting that, and we should have the media celebrating that, because it really is an incredibly cool thing.
Okay,
Yeah, anyway.
great, thank you.
Other
So that's it.
questions? Yeah.
I'm sorry. That's it for me. If you all have questions, I will just say to you, I can say everyone is as busy as they could be here at First Life California. We're still working on the supply efforts. We're still partnering and keeping in touch with California Department of Education and others, so we can make sure everybody knows what's going out to people and where we all can maybe try not to duplicate. Sometimes we do, but to get the largest bang for our buck and get supplies out to people. So with that, are there any questions for me, Shayna?
Yeah, just a couple quick ones. So you said we'll be distributing 500,000 books across the state, but it sounded like not every county is doing it.
Right. Right now we have 42 of the 58 who have turned in a letter of intent saying they want to participate. There is no funding for the counties in this process. This is like them saying, yep, send us the books, we'll get them out. And so that's how many. We think this is a first step in an evolution.
Can you let us know which counties won't be participating?
Sure, happy to.
And okay, and do we believe the reason is because they don't have the capacity to distribute?
I'm sure it may be a workload issue, for folks.
Okay, I'm just wondering, and not to derail the conversation too much, but just from an equity standpoint, I don't know if we have any dollars available to support some of those capacity needs so that every county could participate, because I think it's a shame that not everyone would have access to this resource. So if there is a way to help out some of those counties, I think that would be okay. And then one other request is, if you have a report that you keep internally around staffing and vacancies and sort of where that stands, if you could share that at our meetings, that would be really helpful. Just knowing sort of which positions are open. And if there's any data you collect, I know other organizations I've been involved in collect information about why people are leaving or coming or all of those things would be helpful.
Okay, thank you.
Thank you. And congratulations on the supplies. I think that's fantastic.
Yeah.
Yay, yay, yeah.
Yay.
It seems like, I don't know about how Chris feels, but it seems like we started that conversation a while ago. So it's good to see it all coming to fruition.
Yep, you responded immediately when we spoke in April. It's been months of you working on this, so thank you. I was like, it's been really successful.
And just one quick thing on the supplies, because it is really extraordinary when you describe all of the numbers and just the volume of what we're getting out. Are we publicizing this?
We have some we can send you. There have been some local newspaper articles of people, handing out supplies. First Five, happy to pass those along to you. And mostly local.
There's a way we can, if Fraser or whoever can push that out. I mean, I just think it's newsworthy and it's great for our name to be on it, to be helping this many people with all of these essential needs.
Okay, we'll get that for you. Thanks. Anything else? Any other questions? So George, if it's okay with you, I'd like to.
Let me call for public comment.
I'd like to. Oh, sorry, you're right.
Yep. Is there any public comment on that report?
Yes, there is.
Yes, there is.
The person who has public comment is item
Okay, so there is no public comment on the report. Someone has public comment in the public comment section, which is item 2. So we'll give him an item. So with that, George, there is no public comment. And if you don't mind, I would really like to introduce again the new, I'm going to say new still, Executive Director of the First Five Association, Melissa Stafford Jones, who is here to give a report to all of you. It's been a pleasure to work with her. We're already, I think, joined at the hip, maybe more than she had anticipated, but we're doing well. So, Melissa?
So we have 3 First Five Association people on the line, and we can't tell who's who. So Melissa, if you could raise your hand, use the raise hand function, we'll promote up that account to a panelist. Here we go.
We got her. Okay, coming forward. Maybe? There we go.
Good morning, everyone.
Good morning.
Thank you so much for having me. Again, as Camille said, I'm Melissa Stafford Jones, the new Executive Director of the First Five Association, and I really appreciate the opportunity to be here with you today. This is my first official meeting providing a report to the State Commission from the association, and so I thought I would take a few minutes to share a few of the themes that have emerged in my first 6 weeks that as I thought about it, really provide a strong foundation for our continued work in partnership between the local commissions, the association, and First Five California. And I thought I'd share just a tiny bit about my own background as well today. And as you know, and has been very clear to me from day one on the job, is that the work of First Five collectively is deeply rooted in shared purpose and values. I go every day back to our co-created First Five Network vision that one day California's success will be measured by the well-being of our youngest children. And I know we are all dedicated collectively to the mission that every child in California will be safe, healthy, and ready to succeed in school and life and to reach their fullest potential. And I feel strongly that this rootedness in shared purpose and values is a really powerful starting point for our partnership. I know it's also the case that we're not near achieving that goal yet, that every child has the opportunity to thrive in school and life. And we know there are deep inequities and that there are also advancements, things to celebrate, things to build on, things to recognize. But also it's just been really clear to me the importance of not losing sight of the challenging work ahead to do really meaningful policy and systems change that will move us toward that shared goal together. Another thing that I have seen and experienced, as Camille mentioned, is the orientation to partnership. The recognition that effective partnership is needed within our network of local commissions, the association, and First Five California, within the issue areas and larger systems that serve young children and their families, as well as beyond early childhood sectors. My experience has made me a very deep believer in the adage of making the whole more than the sum of the parts. And I think partnership that really embodies a bi-directional approach and a relationship between local and state levels where we are taking the on-the-ground experience from the local level, that expertise, that learning about what works, outcomes we can shift, how we create meaningful and long-lasting change, and combining that with state-level program and policy thinking. Really, when those things are working together and going both directions, we can really do, I think, some important work to shape and strengthen the policies and frameworks that we have and the work that ultimately happens on the ground to improve outcomes for children and families. I also want to just thank and acknowledge Camille and the First Five California team for the partnership I've already experienced almost every day and on many issues, and the ways in which the strengths and challenges at the local level are integrated into our collective work and the work of First Five California to strengthen the results that we are all working toward. Another observation I wanted to share was Many times over the last month and a half, I've been listening and learning about programs, systems building, policy work at First Five, and I've had this image in my mind of concentric circles that I think for me represent the holistic, whole child, whole family approach of First Five. I know we all hold children and their families at the absolute center of all the work that we do, but that our work also recognizes that there are the circles around children and families, maybe the closest in being things like kinds of things Camille was reporting on today: home visiting, child care, early identification and intervention, parent and family supports. But then we also know there are more concentric circles out from that, whether that's housing, access to healthcare, food security, transportation, and then of course ultimately those larger concentric circles that are really around the societal structures and policies within which we know families and all of these other systems live and operate, and that shape and result in both some of the positive outcomes, but also the inequities that we see. And I really appreciate that addressing these issues, both the challenges and opportunities in all these concentric circles with a holistic whole child, whole family approach is critical to achieving our shared vision. The other central theme that has emerged in my short tenure is the recognition and the commitment to face and address racial inequities in opportunity and outcomes for children. And the recognition that the work is on many levels, at the personal level as leaders, you know, myself included as a white woman with white privilege who now can see and recognize that the systems that have surrounded me in my life were built with someone like me in mind, and that is not true of all people, and how do we address that? But that also at the interpersonal, organization, and policy and systems level that we need to do this work. And that the way forward to address racial inequity for our children is to be open to listening, learning, and re-examining, being prepared and willing for the work to be hard and uncomfortable, to build an inclusive process that encompasses the many aspects of inequity, including racial and economic inequity for children and families, and recognizes the many kinds of diversity in our community, and that also centers race, given the widening recognition of the lack of focus until recently of the need to address longstanding structural racism. And that this calls us to center the experience of children and families, building on their strengths, their aspirations, needs, and the solutions they bring to the table as we work together to build systems and policy frameworks that advance equity. And then lastly, I just wanted to share, close just a little bit about my own background. My training is in public health and health policy, with 20 plus years of working in state and federal health policy, working to ensure that every Californian, particularly the most underserved, had access to healthcare and high quality care, not only so that people could get the medical care that they need, so that health status could really be improved, so that people could live their fullest lives. My work has always been focused on the safety net, where medical care was a critical component, but also housing and homelessness, behavioral health and wellness, food security, poverty, and racial disparities in health, which of course I know we are all seeing very closely with the impact of COVID-19 in our state and in our nation. I was fortunate to have the opportunity to work in the Obama administration in the US Department of Health and Human Services, and most recently to run a philanthropic organization focused on improving the social determinants of health at the local level, including a core strategic initiative in early childhood. I now feel very, very fortunate to have the opportunity to be a part of the work of the First Five family. As an undergraduate, I actually had an opportunity to work with young children under the age of 6 who had lost their parents to AIDS at a time when we did not have the treatments we have now, and many of the children themselves were HIV positive. And that experience led me to want to really understand where we had failed these children and their families. And that led me to public health and to health policy. And so I'm very grateful now to have come full circle and to be part of the holistic, whole child, whole family, prevention, equity-oriented work of First Five. And I really look forward to working with the First Five California Commission and staff toward our shared goals for our youngest children and their families. So I'm grateful to be here, and thank you for the opportunity to give my first official report.
Well, thank you very much. Great report. Much appreciated.
Anyone have questions? Commissioners, questions for Melissa? Don't see any, George. You want to ask for public comment?
Is there any public comment?
Yes. Oh, no. Yeah. Yes. So this is public comment on this report item. We have someone who's anxious to talk to the commission during the regular public comment time, but this is on the report. Is there any public comment on Melissa's report? No. Nope. George, we're good to move on.
All right. Well, thank you
Thank you.
hugely for joining us. You are very, very, very welcome to the family, and your background sounds absolutely wonderful for the job. So thank you for being here. Thanks for the report.
My privilege. Thank you.
Okay. That moves us to
Committee advisory committees.
advisory. Yes. I'm trying to do this from two screens rather than my usual printed copy model. I think I will go back to the printed copy model, but in the future. But committee reports. Are there any reports from the committees?
Don't see anybody raising their hand. I think we're all on a mission to get done, so
Right.
which is great. I don't think I see anyone, George, who has a report at this time.
All right. And then we don't need public comment on that, I don't believe, unless does
Marcia,
anyone in the public want to comment on the fact that we did not have any committee reports?
Comment on no comment. Okay, we can move ahead and move on. Now we're at public comment.
Now the public comment that the person has been waiting for.
Yes.
Welcome.
Yes.
The members of the public may speak up to 3 minutes on any non-agenda item or item not relating to pending judicial, administrative litigation, or personnel matters. No action by the State Commission may be taken on this public comment. If you wish to comment, use the raise hand function for the chat function. If that's not available, Jamie will call on the public in the order in which they signed up. And we do have someone who has pushed the button, so
Yes.
welcome.
Dr. Doug Major is now going to speak to the commission. Dr. Major.
Hello, can you hear me okay?
We can, thank you.
Thank you. Well, welcome and from smoky San Luis Obispo County. And again, my name is Doug Major. I've been privileged to be able to work with First Five since the inception, the old Rob Reiner days. We have a wonderful preschool vision screening program to be involved with, and would like to make the commissioners all aware that this month is Amblyopia Awareness Month. And amblyopia, of course, is that main problem with kids when they're younger. And did everyone get my handout there on that? Did that come through?
Commissioners, you were sent an email this morning with the information from Dr. Major. It's a one-page kind of fact sheet. Should have come to you this morning.
I have not looked at that.
Okay, well, I'll let you look at it. But this is one for particularly George. My goal is to end ethnic, racial, and cultural disparities in vision care. Sort of paraphrasing your wonderful book. And again, my name's Major, but I'm not related to Jackie, but I would like to be Jackie. So, and I'd like to just do a few points on the increased inclusion of First Five with vision care outreach and advocacy. Of course, this is near and dear to my heart, and I hope you get a chance to read over what I sent you. First point is the prevalence of vision disorder is increasing for preschools, especially with children of color. According to the USC study, it's going to go up 26%. and almost 137% with children with color. This is in your wheelhouse. I'm going to just dovetail with George's comments on literacy. You know, we hear a lot about oral health, but you don't read books with your teeth. This eye care is an issue that I think should be addressed more fully with your group. Point number two, there is a huge unmet need for access of vision care for the children of California. Mr. Hazen, you aware that 145,000 children, excuse me, not 100, 45,000 children enter school in San Diego County without needing glasses? 45,000. Okay, so that's according to a study by the new superintendent of schools in LA, Austin Boostner's group, called Vision for Learning. Unfortunately, the state has dropped their ball here, and now we have to have nonprofits come in and try to help with these literacy. They did some great programs, and that leads to the next point, is the most damaging visual disorders, amblyopia, hyperopia with astigmatism, can be diagnosed and treated by age 3. Now, you've heard a lot about lazy eye, one eye being different than the other and using a patch. But I'm going to introduce you to another type of lazy eye. It's called meridional lazy eye. That is the lazy eye that's most prominent, particularly in the Hispanic population. I just did a small kindergarten in Little Shandon, farm workers town. Of two kindergartens, referred 27 children with that condition. The thing about meridional amblyopia, it's not the type of glasses that you wear. So the glasses that Molly wears and Marcia, your glasses and even George's, these are glasses that you got when you're older or glasses when you were nearsighted, okay? This is a condition that happens earlier. If you have glasses that you're nearsighted, you're more likely to be successful in school. And that's the confusion a lot of times people realize. This type of correction, if you don't correct early and you try to have the child wear it at age 10, it's very hard for them to get used to it because it doesn't suddenly make the eyes better. I'm hoping you investigate that because that is the main issue with kids with color, and also with our tribal health children. Early access to eyeglasses make a big difference in supporting first 5 goals. If your goal is literacy, eye care has to be on the map. We have some great studies that prove that. We think our little teeny county, we have a pilot study that's done a wonderful job. In other words, sometimes I go to schools, and another positive example, a farm worker school, every single child already has the glasses when we refer them with our sister program, the Lions Club Slow Lions Eyes program. They already have care before they even make it to school. That would be the ideal. I would suggest that with First Five's help, it becomes more popular or possible.
Thank you very much for the report. And that's on the material you sent us? So
That's in there with all the supportive material.
Great.
So I'm hoping you look at that, and I'm just hoping that somebody on the board, you know, if one of the commissioners maybe goes a little deeper. I'm older, you can't see me, but I'm an old guy again, way back with Rob Reiner in those days. And so I've really tried to, I really feel like there are some great inroads that we could do.
Thank you. Okay. Much appreciated. Any other public comment?
No.
All right.
Good to go.
That takes us to the consent calendar. Items on the consent calendar to be considered routine will be enacted by one motion followed by a vote. There will be no separate discussion of these items unless the commission, audience, or staff request specific items be removed from the consent calendar for separate discussion and action. Any agenda item removed will be voted upon following the motion to approve the consent calendar. So that's the situation we're in. That the consent calendar is in front of you. I would ask for a motion to approve the consent calendar. Is there?
Anyone?
No one? What do we need? legal-
Jackie,
What?
Jackie moved the consent calendar. George, you just need a second.
Second.
Great, moved and seconded. All right, any further discussion of the consent calendar? Hearing none, all in favor say aye.
Aye.
Opposed? The consent calendar passes. Excellent. Okay, that moves us to the financial update. How are we doing financially?
So George, Marcia Thomas, our Director of Fiscal Services, is going to report to the commission now. We're just going to bring her on board. Somewhere here.
Somewhere?
There she is.
Okay, I don't see her.
She's not on yet. We don't see your face, Marcia.
Marcia? There's Marcia. Hello, Marcia. How are you doing?
Yeah, you see Marcia Bedwell. This is crazy. We have two Marcias. Never do you have two Marcias, and we do. So we're waiting for Marcia Thomas,
Okay,
who,
well.
anybody?
If that's going to be a delay,
Do you want to keep moving forward, commissioners? Are you
Yeah,
all
we-
right?
what would you like to do? Should we go forward to the next topic, which would be the mass media? Is that team ready or?
There she is. There's
Oh, there
Marcia.
she is.
Sorry, had a little bit of trouble. Okay, Marcia, you ready to go?
Ready as I'll ever be.
Okay,
You can
All
hear me?
right.
go ahead.
The stage is yours.
We were trying to get it working, so I apologize. All right, so good morning. It's a pleasure to be with you this morning. I have a few updates to share with you and will be happy to answer questions at the end of my fiscal update. First, I want to thank Commissioners Munger and Hazen for working with us to refresh how we display our fiscal information. We received an informative call and are working to implement the suggestions that we received, so thank you.
Excellent.
Yep. Currently, we have been focused on closing the books, but our goal is to have these new displays for the commissions at the October meeting. Sorry about that. We continue to work with the First Five Association and our county partners, the California Department of Tax and Fee Administration, to resolve areas of concern. By engaging CDTFA in discussions surrounding administrative fees, the methodology on backfill, presentation of reporting, and mapping out processes to establish understanding and predictable timelines surrounding funding distributions, we hope to have a common language and understanding as we move forward. Today, I would like to share with you Attachment A, which is our First Five California Children and Family Trust Fund allocation percentages. I think we're going to bring that up.
Yeah, it's coming.
Okay. So I'll just keep talking as that comes up.
Yep.
As a reminder, per Health and Safety Code 130105, 80% of First Five's revenues are allocated and appropriated to our county commissions and dispersed by First Five California on a monthly basis. The remaining 20% is allocated and appropriated to the state commission. One of the big differences in the funding allocations between First Five California and the counties are the specific percentages and funds First Five California is required to implement. Attachment A displays a 20% allocation to the 6 funds for the state commission. Mass media communications, 6%, education, 5%, childcare, 3%, research and development, 3%, unallocated 2%, and administrative account, 1%. In addition, this attachment provides the purpose for which the funds can be expended. Attachment A will continue to be included with the future financial updates. This is one of the suggestions we heard from our commissioners. In May, the Department of Finance provided First Five California staff with revised 5-year projections for a portion of the cigarette and other tobacco products. First Five uses this data to update revenue projections for the state commission and county commissions by accounting for estimated adjustments to the California Children and Families Trust Fund. Adjustments include CDTFA administrative fees, backfill, and assessments to the fund. Table 1 displays the revised revenue projections for both the State Commission and County Commission for 2021 to fiscal year 24-25. In addition, Chart 1 displays the revised revenue projections for the State Commission operations only. Are we going to put that chart up?
Is that the, okay.
Which
It's
attachment?
actually on the update. So we have the chart on the update.
I think it's a different. Sorry.
So chart 1 is going to compare the estimated tax revenues presented in April 2020 versus the revised tax revenues being presented today. The average decline between the two was 8.2%.
Marcia, can you know which chart you're referring to? Because we don't see anything on the screen and I'd like to look at the
Yeah, so
attachment.
chart 1 is
We're trying to get it up. Hold on, we're Simon's here trying to get the chart up, Shayna.
there we go. So that's one of the
There.
new things that we added to the financial update to kind of show the difference between what was presented in April versus what was presented today. Currently, Proposition 10 and Proposition 56 are combined in the calculation. We're currently working to update the display to break these out amount in our future updates. CDTFA has transferred the following revenues to the California Children and Families Trust Fund for 2019-20. $337 million for Proposition 10 revenues, and this is before adjustments. Of this amount, $303 million was transferred to the State Commission and County Commissions based on the 80-20 allocation percentages. Currently, First 5 California staff are working to close 19-20. Staff will present the actual reconciled year-end financial data to the State Commission in October. For backfill, they transferred $91 million, which reflects the final amount for fiscal year 2019-20. The May revision estimates Prop 56 backfill for 2021 to be $85.5 million and declining approximately $2 million thereafter. Attachment B of our financial plan shows our projected revenues and expenditures for the upcoming 5-year period. Staff across the agency continue to perform internal comprehensive analysis of current and possible projects that are aligned to our strategic plan. We continue to ensure projects are captured in our financial planning to inform staff and commissioners on funding decisions. Also, Attachment C, the fund condition summary, further displays these placeholders in each of our accounts: mass media, education, childcare, research and development, unallocated, and admin. Items in blue are under consideration, while green are current commission requests. At our April commission meeting and at the budget retreat, we heard the request from the commissioners to incorporate more graphs into our financial update. First 5 California is currently working on meeting this request for the commission meeting in October. At that time, we will present actual reconciled year-end financial data to the State Commission. And that's it. Thank you. I appreciate your time. I'll answer any questions if anybody has any questions.
Great. Thank you very much. Are there questions? Huh. No questions. Okay. And we have a time crunch day, so that makes sense. Are there any public comment? Any public comment on the financial report?
No public comment, George.
There is no public comment. That allows us to move forward.
I do, and I know we're in a time crunch. I'm just wondering, so I didn't hear any things we should be concerned about and have reviewed the chart, but is there anything that you would want to flag for us, or anything of particular importance in all of the data that you shared? And I appreciate some of the updates and changes based on our Molly and my conversation with you.
Yeah, thank you for doing that.
Marcia's muted. Marcia,
Oh.
you're muted. She's answering, but.
Okay, sorry about that. No, my sincere apologies. I actually got cut off, so I didn't hear your question.
Oh, so I was saying, is there anything, so having reviewed the materials you shared, there's nothing that stands out to me, but I'm curious from your standpoint, is there anything, any items of concern or anything that we should be mindful of, either today or as we, prepare, for the months ahead and the new fiscal year, anything in particular, of particular importance?
I would say not at this time. I mean, our revised revenues came in May, and it does show a decline, which we anticipated. Right now it's estimated, like for Prop 10, I believe, I don't have it in front of me, but it was about 5% that it was declining. And the backfill was as well. But at the next commission meeting, we'll have the final figures of how we look for 1920 versus prior years, and then how we look going forward. But right now, no.
Thank you.
You're welcome. Thank you.
I just want to hone in to say that Marcia and the rest of the fiscal staff have been working almost around the clock to get the books closed. They have a deadline up tomorrow. So after she's done here, she's off to complete, to continue to complete that work. So
we shouldn't change anything of a major nature right now.
Right. We'll have more information. Jackie?
Good.
I just had a question, just thinking futuristically. I appreciate attachment A and seeing the breakdown of our work. It puts it in great perspective. But as we're looking at the decline in revenue, where do we see the shifts of these percentages? And so, for example, as we go into this new, our new mass media contract, we're going out for a new contract. If those costs haven't decreased, then that percentage of the total, because it's going to be less, will be greater. And so where is that coming from, and how are we looking at those adjustments?
That one, Camille, I'd have to defer to you. I'm not really sure what the media contract.
It wasn't specifically about the media contract. It was if revenue is declining, how are we looking at all the other work?
Yeah, that contract, yes, that puts pressure on every single thing we do. And it puts pressure on the media contract. It's got to be a different media contract because it's got a different base on it than the old one.
So yeah. when we looked, Jackie, at and took into account the information folks gave us as to what they wanted to see in a media contract, and then went and looked at the fiscal picture to say, how much can we afford, looking at the current fiscal amount plus going out, we believe that the amount that will be requested in the next item is feasible and doable, and looking out even with the reductions, that there would be funding plus in that account to make it affordable. So what we try to look at clearly is in the planning, looking at what the need is, how that will affect balances and going out 2, 3, 4 years where you can, where the projections go. We have, as you'll recall, in the budget retreat, we talked a little bit about balances and where we have funding to still make those investments. So we look at that. What's the balance? What is the amount that we have to spend? What, in fact, are one-time investments versus if you had anything ongoing, longer than 2 or 3 years out, what would that take? And so all those are considerations into the final amount that is presented to the commission. But clearly we think about going forward, if, as revenue declines, what are we able to actually afford to do with the work that we do? I think the other thing is to think about, what do we stop doing? Is there work we stop doing because those contracts have come to an end, and given where we're going, that's not where we want to continue to invest. So those are all part of the conversation.
And
And the administrative percentage puts constant stress on that future agenda and operations, because that number is shrinking, and it's not an easy, that's not very flexible in terms of expenses or jobs that need to be done.
So I think thank you, Camille, for your response. I think the last part of your response was kind of where I was going. It wasn't about the details of any particular contract or anything like that. It was more in reference to what our strategy is going to be. And should we be looking at some different percentage allocations, not the dollar amount, but I think the answer will look at some work possibly not being done. So whereas mass media could be 7% next year, are we looking for that decline in counties, children, and families? You know, are we looking at admin? I don't think
Those
so.
are written, I think those are written into the law.
Yeah, so the percentages are specific to the statute.
Okay.
And
Yeah,
again,
but you
that's
can move it from category to category. What you can do is, if a surplus builds up in some category and is declared to be a surplus, you can, after the fact, move it over and spend it down another path. But that's the only path, because the percentages themselves are stuck.
Got it.
I'm going to say though, yeah, those are in, but it doesn't mean that the commission can't choose to, and I'm looking at Marcia Bedwell, our attorney, to spend more. Do you know what I mean? If the commission chooses to say, we're going to do 7%, there's nothing wrong with that, but I don't think. Marcia, am I right? You're on mute, Marcia.
Marcia?
You're on mute. Yeah, there you go.
I think that's right. But it's certainly an issue that has to be considered going forward with respect to every long-term commitment you make in terms of contractual arrangements. But you can make decisions to spend more in an area as long as you stay within the general guideline of the statute.
Myra?
So I have two questions. On that one, that just raised a question for me. So is that only with the 2% unallocated? So is that the only flexible amount that we can go up, like a percentage or half a percentage with the 2%? So the range is 2%. Is that right?
The statute speaks to what has to flow into each of the different areas, and that 2% is a flexibility that you have.
Got it.
But between contracts within, you know, say a media or other category in the statute, you can decide if you want more on this part of that budget and less on this activity that you've been doing. And it's a fact that's going to have to be considered going forward.
Okay. And then my second question was, you know, to Jackie's point, I think my question is like the narrative associated with the numbers. So if in October we're going to get an update of the allocations and then what we propose for the next fiscal year, is it possible with these reductions of 5% or 3%, where the proposed cuts are in narrative? So we're going to eliminate this program. We're going to reduce this program by $50,000, or what the narrative is associated with the number shift. Because in this document, which was really helpful, it was pretty high level. And then the financial document was, honestly, as a non-financial person, not English to me. So it would be helpful to know how the numbers actually translate into our programs and activities. So can we ask for that accompanied narrative of what the cuts equal as far as the work is concerned for October?
Yeah, we'll work on that.
Sure.
Thank you, Marcia.
Thank you. Thanks.
Dana has her hand up, George.
Okay.
So just a quick clarifier to make sure that I'm understanding correctly. So it sounds like per the statute, the allocations can't change in terms of which fund, what the percentage is in terms of what's going into the funds. Where we have the flexibility is on, as those funds fill up, we can use as many dollars as we choose in a given year, depending on what's available in those funds. And there may be carryover from year to year, so that the actual distribution of dollars across all funds may not be the 80%, 6%, 5%, because of how we've spent in previous years. What I'm trying to clarify is, do these allocations have to do with only which funds the dollars are put into, or how we actually spend the dollars?
No, so the attachment A that broke out the percentages is just showing you the 20% that the state commission gets of revenue and how per statute it's broken out to, like, mass media gets this percent. So it's not technically, I mean, we have money in the fund. There you go. So that's just strictly the allocation of the revenues when it comes in. We don't have control as far as like making more go to mass media, the 6%. It's just going to be 6%. But we do have money in the fund itself, and that's kind of what the financial plan is showing. The rollover for the year, that's the fund balance. So it's including previous years and then the 6% going into it, if that makes sense.
So that makes sense, but I think to the previous questions about flexibility, right? And I think to Marcia's comment that we could spend more based on what is actually available in the funds. You can't change the percentages that are flowing into the funds on an annual basis.
Right, you're correct. Yep.
Yep. Okay.
Other questions?
Any other financial? Did we ask for public comment? And was there any public comment?
There was none, George.
All right.
Oh, Chris, do you have your hand raised?
Yeah, I think if I can just try to support what Marcia's explaining, that that overarching chart that takes of the 100% of dollars that are allocated to Prop 10, the state receives 20% of those, and 80% go out to the 58 counties. And our 20%, it has to be divided into these 6 accounts. That's how I think of them, almost like 6 separate checking accounts. But in each of those accounts, we also are bringing a balance forward every month. So those balances don't align with the original percentages of the total amount of money that might be available for spending. So what's useful is to be reminded as it comes in, it's divided up that way, but as it goes out after 22 years, the numbers it wouldn't be divided up that way. So when we go into October, and we're going to see graphs and we're going to get more narrative of what's available in the accounts based on fund balance, new revenue, and projected revenue, we'll be able to make decisions about what to continue, stop, or start, because we'll have that more global picture of the account. So we know what we're really spending and what the impact is on that account over time.
Yes.
And I would just like to go back to my original inquiry because I stand on my question, which is we're not earning money outside of these allocations. And so I would argue that media costs aren't going down unless we see a trend that media costs are going down. And so I just think, I understand now that those allocations in terms of the revenue coming in for Prop 10 are stationary. And then the rollover from any account is what gives us the money that we're spending. I'm really thinking futuristically as we plan budgets, and that's what I do most of the day, is how are we thinking about that since media or that line, I'm not picking on that line only because it's so expensive, just how we are thinking about in the future may be 5 years, it may be next year, as those costs continue to go up, as all costs are going up, will there be a need at some point? And hopefully sooner than later, will we be able to think about strategizing, to Camille's point, maybe there are things in the future we are not going to be able to do. Tobacco dollars are going down. And that's just a question, it's a question I've asked a couple of times, just in terms of the revenue projection, and we've seen it on a couple of things, but just how that aligns then with program goals and work goals of the commission.
And that's exactly right. That work will need to be done because those dollars are going to change, they are going to decrease, and things need to be done. So the question is, given the decreasing cash flow, what things that are being done should change? And how should they change? And so that's inevitably going to have to happen, because your point is that the costs on this stuff are not going down in any category.
And we just don't want to, particularly since a lot of our work directly impacts people. I just don't want to be thinking about that a couple of months before, or having to sunset a program without having had a lot of lead time to really think about how we're going to either be a catalyst and move from that work because we know the revenue is going down, or how we would sunset in a gradual way that doesn't impact the people that are receiving it.
Exactly right. That's exactly right. That plan should be done. That plan should be done, and it should be a multi-year plan. And this is the time to do it with a good sense of both costs and needs. And because you're right, you don't want to be zigzagging at the last minute. You want to be steering forward, and you're better off over a multi-year time frame rather than month by month. But the good news is, none of those formulas are changing. It's not like the legislature is changing allocations spontaneously. I mean, the formula is locked in place. It can be projected. So then the question is, given those projections, how should it be used? You're exactly right. That should be done. And that should be part of the process going forward in the next round of budgeting. So good points. Any other comments on that agenda? That topic? All right, that moves us to mass media communications and public relations contract, and Camille, take it away.
Okay, well, we have been talking with the commission over the last few months about the need to, our current media contract is coming to an end, and the need to go back out again for the next round of investment in a media plus public relations contract. Jamie Ann Collins Lopez will be presenting to you, there she is down there, today with a request for funding, for the commission to approve a request for funding so that we can go forward and prepare and request for proposal to go out. And we have presented this information to the Public Education and Outreach Committee to get their feedback on what they would want to see within that scope of work, what kinds of activities they would want contractors to do, and as well as with our county partners and other stakeholders to talk about that. So with that, I will turn it over to Jamie to present to you, commissioners. You have some background in your, I was going to say in your binders, which is not true. There are no binders anymore, but up online, and that have been sent to you. So Jamie, go ahead.
Thank you very much. Good morning, commissioners. In an effort to keep everything short today, I'm going to try and move this along quickly. A lot of the detail is in the item for you, but I will go over that right now with you. So thank you for having me here. Today, staff is requesting funds to release this RFP to secure a vendor to develop and execute a new 3-year media PR campaign for First 5 California. A media PR contract fulfills our obligation to use allocated funds to develop a mass media and PR effort to help inform and educate California families on the importance of early childhood issues and their role in their child's early development. Additionally, this effort will focus on engaging with local and elected officials to promote the First 5 supported legislation and policy priorities. As previously reported to the commission, both the current media marketing and PR contract will be expiring early next year. Staff would like to advertise for a combined media and PR contract to start in June of 2021. The new contract will expand on the success of the Talk, Read, Sing campaign by incorporating other vital messaging points such as early literacy, home visiting, child health and nutrition, dual language learning, and other First 5 California parent education focus areas. The contract vendor will be tasked with researching, developing, and conducting multiple campaigns that will focus on reaching our target audiences as listed in the item. Using the contractor's expertise in reaching culturally diverse populations, market research analysis, and community partner engagements, the campaign will find new ways of connecting with populations that have been hard to reach. The contractor will also develop a statewide PR strategy that will increase public and policymaker awareness of the First 5 brand and policy priorities. In the last few months, staff has consulted and received feedback from the Media Advisory Committee, First 5 county partners, and outside agency partners to develop the goals of the new contract. Some outreach goals of the new contract will focus on the following: populations who are underserved and hard to reach, developing messaging through a variety of formats and in multiple languages, conducting market research to ensure messaging is reaching target audiences, elevate awareness on the importance of children's issues, build in flexibility for messaging around current health disparities, increase policymaker awareness of the First 5 brand and messaging, serve as the resource for coordinated communications, advocacy, and other capacity building efforts, and develop messaging that highlight equity awareness. We are looking to find a contractor that will share in the mission and vision of First 5 California to see that all California's children thrive and reach their potential. As previously mentioned, the contractor will have extensive experience developing content for and working with diverse populations. The RFP process, contractors will be asked to provide samples of previous campaigns they developed in this area. Staff is recommending the commission approve $67 million for the staff to advertise a new 3-year media and PR contract. And I'm going to share our slide here of our current balances. As you can see, this is the projected balances for the media account over the next 3 years. And you can see that the proposed dollar amount is a fair share of the media account balance, leaving enough for future efforts as they come up. It is the goal of staff to release the RFP in November of 2020 and award the contract by next March, giving plenty of time in between the awarding of the contract and the onboarding of a new vendor. Thank you for your time, and I'm happy to answer any questions.
Questions, comments, feedback?
I just have a quick question. On the handout, it lists that one of the considerations is that bidders share the values of ethics and equity and inclusivity. Do we have any rubric or something? How is that measured? Like, what do we look for in terms of how they hire, what their mission statement is? I mean, because I see this a lot, that this gets written into things. We do it in my organization, but just to see how do we really interrogate that, I guess is my question.
So we do that in a couple of different ways, and that's in the RFP. Not only, we can request obviously to see their mission statement, and we would be interested in not only seeing that, but then their previous experience in these areas. And that would be them supplying us with examples of campaigns they've conducted. Additionally, within the rating area of the RFP, then we would be able to include content around equity and how they've shown that they have worked in these different areas.
Monica,
Yes.
I would also say, and I'm not sure if you were on the last I'm getting confused with all the meetings, but we talked pretty extensively about this. And the other thing I think staff was going to go figure out was we were pretty confident that we could have our bidders be prioritized based on the employment of a diverse staff, and not contracting with diversity, but actually having diversity within their walls. So I don't know if you all have any updates from that, but that's something we talked about quite a bit last time.
Thank you, Jackie. That's great. Thank you.
But I don't know that we have an update. Do we know?
Oh, go ahead, Camille.
No, we're continuing to look into that within the state contracting rules, Jackie, and what we can ask for and not, but certainly heard loudly from the PEO committee that that was something, how we could consider that within state contracting rules and how we could figure that out, if that's.
Yes. Definitely needs to be a priority and part of the process. And we can find out about that after the fact as part of the feedback process on the selection process. You can say, what were those factors? How did they look? How did they play out? And we can become very explicit after the fact, in addition to the steerage, about reporting on it.
Other questions from commissioners? George, do you want us to ask for public comment?
Yes. Sounds like we might not have any more commissioner comment. I'll definitely ask for public comment.
There is none at this time. No raised hands.
All right.
So,
We may be through.
Sorry, really quick.
Is there a motion then?
Sorry.
hold on. George, Myra has her hand up.
Yes,
Sorry,
ma'am.
Myra.
Please.
Just to connect the previous financial conversation with this one and make sure I'm tracking what's been said. I don't know if we can put that snapshot back on the screen that's got the financial breakdown, because I don't think that's in the attachment. Maybe it is. I apologize. That last 11 million, Jamie, is that, Chris, what you were referring to in the carryover that isn't counted as part of the 6% allocation breakdown? So technically it could be more than 6% because each year the allocation has to be 6%.
Well, you see right there, there's a so what is being included, there's a 15% reserve being added to, you know, what money is being held for reserve. And then that exactly in gray, next year end balance rolls into the following fiscal year, et cetera, et cetera. So that's depending on whatever, see how that number goes up and then down. That's available as well on any, so there's 11 million more dollars in 1920 based on what's projected there to spend out of that account. It doesn't have to roll forward, but it's being shown as rolling forward in this
It
scenario.
needs to be spent on that topic, but it does not need to be spent in that contract.
It could be spent on anything. If you look at the very first thing Marcia showed that had the statutory definition of what that account can cover.
Yes.
That's what these dollars can cover, Myra. It's narrow but fairly general, you know, within those definitions. There's a lot of room to think of ways.
It could go into the
of
contract
communicating.
or it could just stay in the category.
It could go into several, as the commission thinks about the strategy going forward. That's funding that is available. That funding, if the commission approves the media contract that we're suggesting, that net year-end balance would be available for other considerations, other investments that the commission may want to go forward with over the
And
next.
it would be even fair to say, the 23 or the 18 or the 22 that are being projected for marketing PR do not have to be spent on that either. In other words, as long as you're following the statutory language for this account, you could look at the 41,698,724 and say, we might want to do, very, very, very different things than are being recommended here. And so long as we follow the law and use the dollars as described in the Prop 10 statute. What you're doing here, because that's always what staff do, is they're bringing recommendations to the commission for ways to use the dollars in the accounts that are compliant and consistent with history. And then each commission looks at it and says, is that still the right thing to do? Is this still the right way to spend this money? Should we change the way we do marketing and mass communication? I think, Myra, what I hear you asking in these conversations is for more, almost like sort of more of an opportunity to strategically plan within each account. It's kind of, and maybe I'm reading too much into it, versus only reacting to what recommendations staff bring, which, I'm really supportive of staff bringing recommendations because that's how we get work done. But it's also sometimes hard to have the bigger conversations at the same time as you're looking at a specific recommendation.
Right. And also know at what point in time are we having those strategic conversations? When is the appropriate point in time to weigh in on those processes so that it isn't throwing staff for a loop, but that it is a thoughtful, intentional conversation on what the work ahead is going to look like. So yeah, that's really helpful.
That's exactly right. And on this particular topic, in this particular motion, a particular amount is being allocated for this particular contract. And when we vote on it, it's going to take a roll call vote because of the amount of money involved. And so this particular contract going forward will pretty much target that portion of this spend for that time. But the commission has a huge amount of flexibility about the rest of that money in that category.
Go back to the pictures.
So with that, there is a motion.
You need a motion, George?
Yes, we need a motion. Is there a motion? There's a motion in the book. It says I move to approve the release of a request for proposal, etc. Would anyone on the commission care to pull that motion up and make it?
So moved.
So moved. Okay, thank you very much. And is there a second?
I second.
Moved and seconded. Excellent. Is there any further conversation from the commission? And then I'm going to ask for public comment. But before I vote, any further discussion from the commission?
I have a question.
Yes.
I'm assuming that this proposal came through the commission's subcommittee or advisory committee on this topic. And this is the one that Chris and Jackie, I think, both sit on. I'd love to just know whether this proved difficult or controversial at all, or was it an easy process, just so we understand?
Good question. Comments?
I don't see either of the hands up.
Well, Jackie, do you want to respond first, or?
Not really, but there are lots of us on this committee, right?
Right.
Shayna as
Yeah,
well.
I mean,
Shayna
I
and
think
George as well.
we broaden this so most of you have perspective on this. I'm sorry, I wasn't throwing it back at you. I was just saying we have talked about this, and I think now that we've opened it up, and so I was just going to defer to one of you just from your perspective. I second it, so obviously, you know, I support it. But are there any other thoughts?
I can, Molly, I think it's a great question because I'm always curious what happens in other subcommittees too before it comes to the full commission, because there's obviously deliberation. But the staff brought many different items to us over many months, including the branding conversation that we had last time that we decided to postpone temporarily to address this question, which is really sort of in an overarching way, how do we want to partner with media experts going forward to ensure that we're doing the very best job we can to reach the populations we most want to reach? And that gets to so the same questions that came up on this meeting came up in our subcommittee meeting, which were, how do you structure that? How do you write that into an RFP? How do you ensure that you're getting applicants that have the skills and the expertise to reach these populations that we're really anxious to reach? And what unique and creative solutions do they have to reaching them versus mass media buys, which are not a thing of the past, but you know, we've moved to some very different platforms since the early days. So this conversation sort of mirrors the subcommittee conversation, and Jamie Ann's doing a nice job of trying to like really get it into an RFP, which is hard, taking different recommendations from us and then turning it into a document that Department of General Services will approve and let us share with the public.
Yes, this motion was enhanced significantly by that discussion.
Okay, good. Thank you so much. That helps. Thank you.
Thank you. All right, any public comments?
No.
All right,
No
hearing
public
none, we're going to do a roll call vote on this. Jamie, will you call the roll?
Myra Alvarez,
Approve.
Monica Fitzgerald,
Yes.
George Halverson,
Yes.
Shayna Hazen,
Yes.
Jackie Majors,
Yes.
Molly Munder.
Yes.
And the vote was overwhelming, unanimous in favor. So that's official. No. Okay, now we have a lunch break scheduled.
George, can I just interrupt?
Yes.
We have 3 commissioners who have time-sensitive departure. So I'm wondering if we can go forward and do the rest of these action items so that if people have to get off, then we've at least got the action done and postpone lunch for through these next 2 items. Is that okay?
If that is satisfactory to the commissioners, I think it's a good idea. What do you think? Do you want to do a lunch break, or should we go forward and finish, as Camille suggests?
I'd like to go forward.
You'd like to go forward? Yep. All right. Anybody want to do a lunch? Okay, hearing none. Camille, let's do the action items. Where are we?
Okay. We're at item 6, shared service alliances for small early learning and care settings. Erin Doobie is with us up on screen. She's going to present these items to the commission. They're actually, they're 1 and 2, but they're almost tied together in the way we talked about them previously. So with that, Erin, I'll let you go.
Okay, great. Can everybody hear me okay? Okay, we're having some interesting internet issues in our house today. Everybody's getting kicked off, the kids distance learning and myself. So just let me know if anything blips out. So good morning, commissioners. I'm going to talk, as Camille mentioned, about a couple of strategies for quality improvement that we introduced to you back in May. And the first of which is shared services alliances. So as you may recall, shared services alliances are a way to leverage efficiencies and partnerships to expand the supply of quality early learning programs. And this is specific to small businesses like family childcare homes and small centers. Shared services is a framework, not a model or an initiative that would be implemented to fidelity. So it looks differently based on community needs and resources, which is essential in a state as diverse as California. So as you saw in the written item, this is not a request for new money, but a reallocation of $1.5 million from Impact 2020 funds to support local grants for startup or expansion of shared services alliances. So since first presenting this proposal in May, we've internally reviewed our budget for Impact 2020, and we're proposing to move some evaluation funds in order to fund state infrastructure projects. This is in order to better support COVID recovery and really directly benefit providers, children, and families. So $2 million will remain in the Impact 2020 budget for evaluation, which both evaluation and program staff feel is sufficient. So shared services alliances have been discussed as part of the master plan development, and First 5 California can provide funding to support the expansion of this framework at a time when providers are desperate to keep their doors open. As you know, COVID has devastated early learning and care providers, and has been estimated that up to 60% may never be able to reopen, drastically reducing the number of available slots, which are already insufficient to meet family need. So this is where shared services could be an incredibly effective strategy in providing both pedagogical as well as business support. Strong fiscal and program management are necessary for high quality and sustainability, but most early learning and care services are delivered in very small programs. So the benefits of economy of scale are not realized. Shared services alliances are an emerging model in California and many other states to strengthen small early learning and care businesses by supporting them to become financially sound and more efficient, which also gives providers more time to focus on what really matters, which is the children in their care. Business services offered by shared service alliances include enrollment management, attendance tracking, subsidy and grant management, and accounting services. And these are some of the services offered through one California model, the San Francisco Early Learning Alliance, which is funded by the Mimi and Peter Haas Foundation. Substitute pools, shared health benefits, and bulk purchases are also potential business benefits. Teaching supports are an equally important part of shared services, and these alliances could support shared professional development, learning communities, and leadership development. First 5 California recommends moving forward with this funding and developing a request for proposal informed by best practices and lessons learned in California as well as in other states. It is also recommended that alliances support both business and pedagogical leadership and leverage existing efforts of Impact 2020 and Quality Counts California. These would be competitive grants, prioritized in key areas of the state, and support target populations that are important to this commission. We would work with the Program Advisory Committee to develop the application and funding priorities. And with that, I'll open up to see if you have any questions about this model.
Any comments or questions?
Yes.
Thanks.
Oh, go ahead.
Go ahead, Shana. No, please.
Okay, so just a quick one. So I understand how this works with payment systems and enrollment systems, but when you talk about pedagogical, explain how it works on the sort of non-business side.
Yeah, so essentially it creates a network of providers similar to what we already have with family childcare, home education networks, or other, if you think of some of our larger multi-site programs in California, Kidango is one of them that some of the commissioners might be familiar with. They're out of the Bay Area, and they have, maybe 50 sites, and they are actually considered a shared services alliance themselves, and they actually run the business side and the pedagogical side of that alliance. So actually, as a former employee of Kidango, we had annual sort of staff retreats where there would be a whole variety of leadership development opportunities, almost like a mini conference. And without that sort of collaboration and that larger alliance that can help to oversee that, a lot of times providers just don't necessarily have access to it. So, you know, they can provide substitutes in order for providers to attend training or further their education. And that's just something that's really hard as a small independent, especially if you're thinking about family child care providers. So they really can create sort of learning communities. And Quality Counts California and Impact 2020 do that as well, which is why we're recommending that those efforts really be leveraged, because I think that there could be a really nice sort of merging of using some of those existing resources and ways to connect with providers. But without somebody to really spearhead that, it frequently just doesn't happen.
Thank you.
Okay,
Sure.
other comments?
You answered my question. I was going to ask if you could highlight some specific examples in California. So thank you.
Sure.
And Erin, if you could just remind me, and when we talked about this, one thing that I was just curious about was some of these other models, particularly those in California, what was the utilization from family child care providers or center-based? Did we get any more information on that?
Well, we do have, and I can send you, and I apologize, I just received it yesterday, some information that was provided regarding a number of models in California. Candango is one that I mentioned, and then the San Francisco Alliance is another one that focuses more on the business side of things. There are a number around the state. Los Angeles, First 5 LA has a few different things that they fund, and it just kind of depends. It's an opt-in strategy. It's voluntary for those who would like to participate. So I don't have numbers on how many sites. I think, like I mentioned, Candango has about 50 sites. I think some of the other ones are a little bit smaller. They might have, you know, a smaller network of 20 or less family child care providers. So it just really depends. It really is still an emerging model in California. I think I saw maybe 6 different examples that were provided to us. So that's why we're sort of looking to provide a little bit more seed money to where we could expand models that are existing so they can bring in more providers or create shared services alliances in areas of the state where they don't exist yet, such as far north.
Mm-hmm. I appreciate that. I think that I really support the idea, particularly for family child care providers that are going to be trying to recover after this COVID piece, where there are opportunities for this sort of shared service alliance. I think that's a great opportunity. However, I always want to think when we're investing money, I always want to think about people's opting in, you know, and how beneficial, while I think it might be beneficial for them when they're dealing with their own businesses and having to navigate staffing and recruitment and things like that. Sometimes it's so ominous or overwhelming, they don't engage, and we're going to invest in it. So my second question is, because again, I support it, is was there, and forgive me if I've forgotten, was there an entity that we were going to support? Because I don't think we were going to be the hub, right?
No, that's correct.
Okay.
So the request for proposal would be an application process that's competitive, and entities that are interested in sort of being that lead alliance in their area would submit a proposal and let us know sort of their target sites, give us some background, and, you know, we can work to craft an application that, you know, ensures that we get the right kind of applicants and that they're serving the providers that are most in need of making those connections and, you know, appreciating those services. So that will be through the application process. So we will oversee those alliances because we will be funding them, but they would be individually letting us know what their model is going to look like. And it could really be different around the state because it does look obviously very different around the state. And that's one of the things that we really like about this, is that it's really a framework, so that there is a lot of flexibility in terms of meeting the needs of the providers who are interested in participating.
Mm-hmm. And just a thought, do you see, like, for example, down here in LA, and I'll assume there's something similar other places, there's a couple of childcare temp agencies. Do you see them as entities that would be eligible to bid on these projects?
You know, we haven't gotten into the details of it in terms of who the potential contractors would be, because it's competitive. We would need to, you know, write the RFP, and then we would have to score the applications. And I think it would just depend on, you know, sort of the completeness of their applications. But I also think that there is room for the commission to weigh in on, you know, whether or not there are particular types of entities. I could see potentially a resource and referral agency being interested. Like you mentioned, I could see, you know, somebody else that's already sort of functioning more in the business side of childcare. There are a couple of more tech-based platforms that providers can sort of opt into and buy into. One of them is called Wonder School, and that's sort of another option, although a lot of what we see right now is really the business side of things, which is really important. But we would also, I would personally like to see them really incorporate the leadership development piece and you know, the shared professional development, even if it's just making sure that they're connected to existing resources and to Quality Counts California and Impact. So kind of like to see both sides of it.
I agree. And once we get to that point, I know we'll have an opportunity to weigh in. And this is not to, you know, X out a particular group, but, you know, with all of our other initiatives, I think we're having these sort of shared goals of wanting to ensure that our work is reaching diverse populations, but that also, while the business side is really important, that it's not profit-based in mentality, but that it really is around building the EC infrastructure, supporting with these shared alliances so that there are mutual benefits and sort of the compassion around that. I know compassion and business don't typically come together, but I could just see some for-profit entities that are already working on some of this stuff wanting to really be, this being very attractive to them.
Yeah, and absolutely we can put parameters around, you know, application requirements and, you know, applicant requirements as well.
Chris, did you have your hand up?
I do. So everything that was just talked about as being, you know, potential criteria for the applicants, Aaron, I think that's all extremely useful. But one place where I might disagree is around profit or nonprofit applicants, and I'd like to explore that further. I know from a deep dive into this through the master planning process and through our preschool development grant partners in other states that many for-profits have had a longer time to work on some of the, in some cases, some of the business tools that can be really helpful, and they've made great progress. So in thinking about how to craft our RFP, I would be sorry to see us prevent them from applying. So whatever can be done to allow that to occur in a way that's fair, I think we might be missing out on an opportunity to see some pretty advanced efforts that are out there. So that's, you know, something we can continue to discuss, I hope. But if it's absolutely forbidden that we work with a for-profit partner, then that's a moot point. I mean, that may be the case.
Yeah, Kristen, I just want to clarify. I didn't say for profit. No, for profit mentality without commitment to invest in the infrastructure of ECE. So I come from for-profit background.
Totally agree. Okay, great.
So that is that's not the words I use. So I apologize if that was the intent that you received.
Well, which brings me to this other point, which is one that Louise Stoney and other national experts make when they're talking about shared services models, which is those that have been most successful have been grassroots organizations. They've grown out of a community of providers who then potentially partner with someone in the business side who has those tools ready to go. And it's the combination that's been really, really successful. And so however we craft this, getting the best of both the profit and nonprofit worlds could be really cutting edge for California. And in some ways, I'm really excited because we talked about this when we delivered the master plan overview to you a few months ago as being one of the sort of, areas for, investment for California, and First Five's positioned to do something sooner than the state is. So that's exciting. And then last but not least, do you think there are any other funders or funding you can leverage in this other than First Five, philanthropy or other money out of the QCC effort that CDE is partnering with you on? Is there any other place to make the RFP amount bigger than it will be if it's just First Five California?
Yeah, we can certainly look into that. I know CDE's money tends to be a little bit tight with their budget, but we know that there are private funders who are already investing in this. So we can definitely do some outreach and find out who might be interested in sort of going in and being able to contribute as well. We did estimate the grants, I think, at about, it was like $150,000 maybe. And that was a number provided to us by Abby Thorman, who I think has, done some research and has some familiarity, but certainly, more would be better. So we can definitely look into that.
And then the last point on this around, once they're in place, well, to consider in the RFP is what data are they required to give the commission? Or how are we able to monitor what's really happening, what models may have worked best, what didn't work, without getting too far into an in-depth, expensive evaluation. If there's a way to have the accountability piece spelled out up front, I think we'll want to keep tabs on that, because for all the reasons we just mentioned, there's a lot of experimentation going on in this area, and that can be great, but it can also be that some things aren't great. So
yeah, absolutely. So we always build in accountability in our funding opportunities, but we will definitely, and data collection as well. So we will, look further into what types of information we want to collect, how we want to collect it. We're, we have an online data reporting system. We're also developing an online portal that Camille mentioned for reporting. So we'll have a couple different ways. And then the other thing is, because this is funded through impact and we still have flexibility in terms of the impact evaluation, we could build in a piece of, really looking at some of this work with that Impact 2020 evaluation funding as well.
Great.
Okay.
Can I would like to make another comment quickly.
Yes,
This is a pretty small grant. It's pretty small. And it's also pretty early days. We're going into a field that is, growing, it's emerging. And I must say, I really liked this public-private partnership idea, and perhaps giving some points, some extra points for that. If you could get people to apply as pairs, buddy up, because it is so small, it is so early. And one of the things that we can invest in is social fabric and teamwork. And if you say to people, you're going to be better off getting this grant if you've got a buddy, a private person needs to be with a community needs to find a good, I think it would, it'd just be a real field enricher. They'd have to go find each other. They'd have to sort of start thinking that way. And that just might be very promising to me.
It'd be very catalytic.
Very catalytic. That's sort of more bang for the buck that way.
Yep.
Jackie, what do you think about that? Do you think is that crazy?
No, I don't think it's crazy.
Good. Oh, God, well, that's not exactly a rave review, but.
I wanted to make sure I wasn't misinterpreted, so I'm just answering your question. No, I don't think it's crazy.
Okay.
I'll stick to the script.
Okay.
So,
Other
George,
comments?
both Shayna and Myra have their hands up. So, Shayna?
So I feel like Chris was in my head, all of the things she was saying. I was thinking, and I am wondering, so in terms of additional dollars that would make this more impactful, Erin, it sounded like that we would like to have more dollars, but they're not available. What is that amount? Like how much more? And sort of going back to, I think, some of the conversations around dollars available and flexibility and spending dollars. I understand that what you're asking here is not for new money, but just a different use of already allocated dollars. If we were to consider, and I like Chris's idea better around getting private dollars, right? Like that is always, you know, the best, right? Not using our own. But if we were to take a look at dollars that we have available, what would that amount be? And is that something we should be thinking about? Right?
Yeah, I want to go back and kind of look at that. Yeah, before giving a specific dollar amount, the 1.5 million was the sort of original suggestion. I think in, you know, thinking about some of the conversations that have been had during master plan development. So I would probably want to go back to some of those folks and find out truly where would the best impact be. Is it more money to alliances to be able to bring on more sites, or is it more alliances because they're really better done in small groupings of providers? So it's a great question, but I would want to get a little more information, and we can always come back to you with that.
Thank you. That would be great.
Good.
Myra?
Myra?
So my question to that point, Erin, just really revolves around what you had briefly mentioned about working with different technology platforms. There's this big movement in healthcare towards community resource referral programs. So Kaiser Permanente, for example, Unite Us, Aunt Bertha, One Degree. Is that one of the opportunities that would qualify under this RFP for early childhood centers to contract with one of those companies to do this sort of connection to other services in the community? Or is it only to create additional sites that allow for economies of scale, so to speak?
I think that there are some different possibilities, and because you know, we haven't developed the RFP yet, we still have the opportunity to decide what we want to do there. There are a couple of platforms, tech platforms that are supporting early childhood education sites currently in California, so we could look at those. But the two that I looked at were more specific to the business side, and so I think if we're looking at really that holistic support, we want to look at the teaching and the leadership side of it as well. But I'm not opposed to that. We just really need to decide what our priorities are in terms of the types of services they provide and how they provide them. And it's also possible that, you know, it would benefit us to expand or create a few different models using the shared services framework to see really what works best. And it may be that different you know, different models work better in certain areas. So when you're thinking about technology, you know, you probably think of, you know, bigger urban areas have really great internet access, and some of those sorts of pieces, a little more tech savvy providers. But, you know, it may be that in the far north that, you know, that's not something that really works as well for their providers. So I think some of it can just be, you know, looking at a few different options and figuring out which ones work best for which types of providers and different areas of the state. but we are absolutely open to any suggestions, and we're really excited to get working on this and get additional commissioner feedback and get some feedback as well, I think, from some of the locals who are already seeing this implemented in their communities, to just have deeper conversations about what's working and what's not, and what they might change if they were going to expand or create new alliances.
Sounds very flexible. Are there any other commissioner comments? Is there any public comment before we take it to a motion?
No public comment, George.
All right, would someone on the commission care to make the motion?
So moved. Do I have to say the whole motion?
No.
I think.
Okay.
Not if it's the same as what is on in the packet.
If you don't change the wording, then that would be the motion. Is there a second to that motion?
I second.
Moved and seconded. Any further comment? Hearing none, all in favor say aye.
Aye.
Opposed? Carried unanimously. All right, next topic.
Okay, Erin's just going to keep talking.
Me again,
about...
keep talking.
Yep.
So moving on to item 7, which is investing in workforce development and support. We are again recommending that the commission approve a reallocation of money that was earmarked for Impact 2020 evaluation and redirect it to better support the early learning workforce post-COVID. So this recommendation is for $1 million to fund content development for a professional development platform that aligns with First 5 California goals, priorities, and target populations. An investment in workforce development and support is a key area where First 5 California can provide investment and leadership that will not only impact COVID-19 recovery on a statewide scale now, but also for years to come. So like the shared service alliances, this investment is in alignment with the direction of the master plan and will support key content for a professional development system that is already under development. This investment is critically important now, as I mentioned, the early learning and care sector has been badly hurt by COVID-19. In order to rebuild, the early learning and care workforce needs quality professional development that is easy to access and leads to meeting the career goals that providers set for themselves. Education and training is needed for new providers who are coming on board, as well as to expand existing providers' knowledge in critical areas, including children's social emotional development and trauma-informed care. The importance of this item is reflected in recent data from the California Early Learning and Care Workforce Registry. Since March, there has been over a 60% increase in new profiles in the Workforce Registry, with nearly 9,000 new participants in just 3 months. There's also been a huge increase in usage of the California Department of Education's existing training portal, with an increase of completion of online courses of about 1,700% from February to May. So those are really huge numbers. We have just seen the field being really eager for more coursework, training, and resources. And with the increase in usage, there's continuing need to increase capacity and breadth and depth of content. So funding for the content development is in alignment with the goals of Impact 2020 and will be included, as I mentioned, as part of a new professional development platform that is under development. The Department of Education is currently working on that. This platform is envisioned to serve as a comprehensive professional ecosystem for the early childhood workforce that includes competency-based and stackable content. It will be engaging, interactive, and mobile-based, which is really important, and targeted for different roles within early learning and care field, as well as for providers working with different ages of children. The content will also address providers in different settings, including First 5 California priorities of family, friend, and neighbor, and family child care providers. The platform has learning opportunities for the workforce, all the way from pre-service to degree attainment and everything in between. So we hope that commissioners share our excitement in being part of the development of this platform and see the possibilities in terms of helping to really craft some of the content areas that are important to all of you. And so with your support, we would move forward in partnership with the Department of Education and the Department of Social Services as that transition takes place, and designing content that help providers achieve their goals and positively impact the kids and families they work with. So that's all for this one, and I can open it up to questions.
Yeah, quick comment on that one. It sounds like some exciting developments might be done. Is it possible to share that information immediately with the commission as soon as there's anything of substance or relevance, just to send it out as an FYI to the commission and the world to get a sense of what's happening there? That shouldn't be that hard to do. And
Yeah, I mean,
it's very quick, right? I mean, this is, people are trying to do this quickly to be respond to the opportunity.
Yeah, I mean, I think that the content development will probably happen over about a year, and the platform is currently being developed. So we need to get on board, if we are funders, with the group that is really spearheading all of this work, and this will really get us at the table to be able to filter in our ideas and priorities.
This is a year process, not an immediate shutdown.
Nothing quick ever happens in state agencies except maybe getting books out to kids. That's probably the quickest thing we've ever turned around. But yes, it will take some time. I do believe that we will see some recommendations around this from the master plan, and that's scheduled to come out. I believe it's still October. But Commissioner Perry might know if there have been any changes to that timeline. So it will take a little bit of time to get this all up and running, but we're really excited to be able to dive in and work on that.
Okay. Any comments from the commission?
Chris had her hand up. George?
Chris.
Yeah, just backing up a little bit, you're developing content and in partnership with others. Do we own this? So I'm worried about intellectual property a little bit, as so I love when we pool and collaborate and leverage, and then I also worry that we are co-owning something or don't own something, and we're a major investor. So when I think about particularly this kind of thing where it's very much about intellectual property, do we own it? Does some private entity own this? Does CDE own it? Going forward, what do we have at the end of the day? Other than feeling great about investing in a much needed online professional development platform.
Yeah, generally speaking, when we fund these sorts of projects and this kind of development, we do own the content. My understanding at this point, and you may know more, but it's that this would be non-proprietary, so it would be easy to access for providers across the state. It may be that some of the content does require payment for taking coursework, college coursework, that type of thing. I think those are some of the details to be worked out, and would certainly be included in any contract that we enter into in terms of the development. I think we would like to see that this be available to all, but certainly would want to, as we do with all of this kind of information, we are designated as a funder and recognized as such. But I think, there are more conversations to be had in terms of what that looks like. And certainly, Marcia can weigh in more on the legal aspects of that. But generally speaking, when we pay to create content, we do own it.
Okay, other comments or questions?
Myra has her
about
hand up.
Myra.
If there's an opportunity to align this work with our commitment to equity, and if there's opportunity to integrate racial equity as a central focus of some of the content in order to strengthen the capacity of the workforce to better respond to the needs of kids in California. And then I have a broader question associated with this because I'm not a childcare expert.
On
To the
that first
extent that
point,
there's,
before you go to the broader,
Excuse
we could require that as part of our spending, that it deals with racial equity. We could make that a requirement. And that would,
great, cool.
yeah, should do, yes.
And then along those lines, is there anything that incentivizes people? Like you get a higher quality score, you get, I'm looking at Jackie, like what is the field? What are the incentives to make that happen? Whether it's an increase in payment, a bump, or is this more long-term thinking about ways in which we can start to institutionalize the expectation of prioritizing racial equity, and how that might play out, or this could support that effort more long-term?
For me, I think some of this is the devil's in the details, right? And one of the questions I had was, it seems very collaborative. Is the 1.5 million, or is this the 1 million? Is this paying for the totality of the development of the curriculum and the process? Erin?
No, this is a portion. The $1 million is a piece of it. And I haven't seen the overall budget for the platform. This was something that was presented to us as a potential match in terms of First Five California's interests and where we might want to invest. But we need to get, I think, more details, but it would be up to $1 million to pay for content development in areas that we choose. We just want to make sure that they, we're not going to duplicate efforts. And Commissioner Alvarez, yes, absolutely. I think that looking at racial equity and diversity, all really great topics that we could definitely address through even a specific strand of content, or it might be content at different levels, whether it's some initial training versus college coursework. I think there's a lot of flexibility in here in terms of what we pay to develop and what our name goes on.
So with that answer, I would argue that maybe we would own pieces of it, but with a collaborative work where we are dealing with other partnerships, I would think not, which I think makes it richer. And to go back and answer your other question, Myra, in terms of, are there opportunities to do steps and improve the quality of the programs? There are already platforms that exist. In terms of, scales and grading and other things of childcare centers. Right now, it is not tied to reimbursement. It's something that California has pursued for a long time, but it is something that childcare providers aggressively participate. Gateways for Learning is one. STEPS program that used to be run by the Office of the Advancement of Early Education here. But the reason I asked the question, Erin, was because I think where there are collaborations of other entities to create this, it does create the opportunities to connect with infrastructure that is already rating and providing incentive and stipends that are coming from other entities, which we're not planning in this money. But if we were to connect with those other entities, again, maybe there are stipends and other things that providers and centers could, workforce could, get for participating and being successful.
Yeah, I think this will be become the sort of one-stop shop for accessing a lot of sort of distance learning and online content for early childhood educators in California. And so it will be embedded as part of Quality Counts California, which does provide stipends for educational achievement or for completing training. And currently, at least in our current rating system, teacher qualifications and administrator qualifications, including ongoing professional development, are sort of wrapped up in the tiered rating. And so as part of Quality Counts California, there are various, stipends and things, and then rewards for achieving higher levels of quality. So I think it's all sort of wrapped up together, which is really what we want to see, is a very holistic quality system that serves all providers. Something else that has been successful in other states is really giving teachers and providers access to drive their own goals and decide where they want to go next in terms of the content that they are exploring and learning about. And so in some states, they do things like they provide badges, sort of like these online badges in specific content areas. And as simple as it sounds, it has been proven to be very rewarding in other types of systems like this, where early learning providers really get to sort of choose their own path in terms of the content that they complete. So I think there's still a lot of development that is yet to come and conversations to be had. And we will certainly look into the sort of, the nature of the agreement in terms of what we own in terms of intellectual property. But I think for us, probably the biggest thing right now is making sure that the content is relevant and up to date and easy to access for a variety of providers. So we want to make sure that we're not creating additional content that is proprietary in nature or has a substantial cost associated with it, because we've heard loud and clear from the field that it's a deterrent for completing that training and really furthering their own career goals. So I think that'll be our top priority.
The last thing I want to say, and I don't know if we can bite off this chunk now, but a lot of the things that you talked about, Erin, in terms of existing infrastructure, do not include family, friends, and neighbors providers. And when 60% of California kids are being cared for under family, friends, and neighbors, it's just something, if we're talking about equity and access, that, if we can't, build in direction towards that now, it's just something that's always important.
Yeah, I would totally support that, echo that. We need to add that to the expectations for this work.
Yeah, the Department of Education is already working on developing content for family, friend, and neighbor providers, specifically around health and safety requirements that are part of the federal dollars that they receive. But this portal will definitely be inclusive of family, friend, and neighbor providers, and there will be content that is relevant to them and accessible to them. So that will definitely be a piece of it.
And we need to add literacy to that.
Absolutely.
Family, friends, and neighbors, we need a literacy, a really clear talk, read, sing sort of literacy piece that's part of that. So yeah,
Sure.
that is where the majority of interactions happen, and any impact there changes direction in a big way for a long time. So good to do.
I know we're going to lose Shana soon, so she had her hand up, George.
Yes, Shana.
Thank you. Just one other thing to add. So I appreciate earlier in the conversation, making sure we're explicit about prioritizing equity. I also am wondering about the languages that professional development is offered in, and if we can make sure that that is lifted up as a priority as well, recognizing that not all providers are delivering instruction in English.
Definitely. That's on our radar as well.
Great. And I do have to jump off in a minute.
All right, you want to make the motion before you leave?
I would love to.
I'm sorry, I had one more question. I had my hand up, but I think you missed it, and I don't want Shana to leave before I ask it. Is that okay?
Yeah, please,
Erin, you're doing an amazing job answering all these really complicated questions. But is it fair to say that no one has been chosen to develop the content yet, and that you're at the very beginning stages? Or is it more accurate to say that's in motion? There is someone working on it. That this is something CDE is leading, or QCC is leading, and we're coming in midstream, as an investor. That, just getting back to my worry about ownership. Is this already somebody's project? or not.
And I don't know if Camille can speak more to it in your conversations with the CDE folks and with Abby, but my understanding is that it is under development, but that the content has not all been determined. So I wouldn't say midstream, but I think that the idea has been around for a while, and that there is money set aside to fund the development of this project. So I think we're sort of a few steps in, but not too far down the road.
Yeah.
Do you have anything you want to add?
No, just agree. I think we're at beginning conversations, you know, and how, and I think people are hoping that the commission agrees to invest, and so the conversations can then continue.
And the reason so there's the intellectual property question, but then also as somebody involved with the master plan and the transition of child care programs to the Department of Social Services, I have received a number of letters and other kinds of input about the importance of racial equity and equity overall in any of our quality projects in California. And so I'm flagging that here as something that is top of mind as we look at who is going to work on it and who they are, what's happening with the product. And as First Five California, it's our job to ensure that we're, you know, aligning what they do with our priorities too. So that's why midstream is a little hard sometimes, because these things start moving and you can't stop them. So Camille, I know I'm happy to share more information, Aaron, with you as we work on this. So thanks.
That would be great. Thank you.
I was ready to make the motion, but Chris's comments give me pause a little. I'm just wondering, in terms of the funding mix right now, so understanding that maybe we are not midstream, but somewhere this is moving, that is moving, dollars have already been put into it. In terms of this blended funding, where do we fit in this bigger pie? Are we like a really mini minority sort of stakeholder here? You know, like how?
Yeah, good question.
How much power does our place have tied to the dollars we would be contributing? What is the million out of what total?
How much steerage?
I'm not sure of the final price tag yet, but I do believe that our contribution puts us at the table to be one of the partners making decisions, you know, being part of those conversations, making sure and ensuring that all of the things you've all talked about today, and to Chris's point, that the people that are actually going to work on this also reflect the population.
Recognizing, I think that's important to everyone, to amend the motion to reflect that, right? That the expectation that we're not only contributing the dollars, but also would ask that in exchange, we are part of this leadership team, core team that is making decisions. Is that, can we add that or tweak that?
Yes.
So that it's explicit, not implicit?
Yep.
Okay,
Yes,
so I'll make that motion.
we authorize with the expectation that we will be part of the leadership team.
Correct.
Okay.
Well, on condition. No, on condition.
Yes.
Because you say, my board has given me the authority to give you $1 million on condition that you put me in the decision.
Yes, exactly.
That's the motion.
Okay, is
There you
that the motion? Is that, Molly, are you seconding that?
Sure.
All right, made and seconded. Any public comment before I call for a vote? Hearing none, all in favor say aye.
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 Any opposed? Carried. All right, perfect. We're all done. It'll be good to have
Nice
steerage
job.
in space.
Nice job, Aaron.
And now that moves us to the next topic.
George, we can go back to, if people want to take a break, a little break, we can.
Would you like to take a break? People, should we take a break? In
Yes.
10 minutes, 15
Let's
minutes?
have a break. How long? 20 minutes?
How long would,
Come back at 1? Come back at 1 o'clock? Does that work for folks?
does that work for
Yes?
people?
Okay,
And I have to say goodbye.
Bye-bye, Shana. Good to be with you, as always. Bye-bye.
And thank you, Molly, for that addition to the amendment. Appreciate it.
All right, 1 o'clock. We'll see folks back at 1 o'clock.
Okay.
Thank you.
Okay.
All righty.
Home visits. Like what's that percentage of your population?
In the survey or in general?
Yeah, 46 seems small, but it could be all relative.
Yes, it is small. So those were 46 families representing 24 programs that participated in the interviews. So our sample was smaller program-wise for the interviews. And I did mention at the beginning, we just asked home visitors who were comfortable sharing the survey with their families to do so. So we didn't want to put a big pressure push on either the home visitors or the family. So it is fairly small.
Okay.
And it is a fraction, Jackie, of the home visiting family supports, but we are hearing anecdotally from some counties that there have been an increase in requests for home visiting since the pandemic. So the number is rising.
Yeah, and I'm sure it is, which is why I just think that this is about to be our new normal, you know, in terms of interacting with families. And I actually think, because I didn't have as much success in my old career in home visiting, because in the LA area and this area, people didn't love you coming in their houses. So I see this, and I know in other places they do, but I see this as a huge opportunity to now get in. So then my other question would be, because I definitely wanted to know ethnicity, but I'm sure it's defined, quite frankly, by some of the geography on the map. So I think I can probably figure that out. It would be interesting to have more data though. But also, I saw a very low percentage, a high percentage on the phone. And what I would love to see, and this is just me visioning, you know, I've got 1,400 Head Start kids that started remote learning on Monday. And, you know, what I'm hearing from our teachers is that when they can encourage the parents to get on their phone, on FaceTime or Zoom or any kind of video conferencing, it really enriches that connection and that relationship. Of course, they're not forceful about it. Any way they can get into the home. But I was just wondering if there are apps, and I'm probably going to go a little bit into George's world, but my 84-year-old mother had a video conferencing Kaiser call the other day, and she's freaking out before the call because she's like, well, I don't know Zoom and I don't know all these things. And I'm like, well, Mom, is there a link? And she said, well, is it underlined? I was like, yeah, just click that. And it went right to video conferencing, you know? So I know that Zoom and all these new things I'm getting on Skype and other things can be complicated. I just wonder if there's something that we can create that is as simple as this Kaiser app seemed to be in terms of encouraging the families to get some FaceTime.
Yeah, so I want to address all of your points if I can remember them. I'll start by saying, while this study won't have a specific aim of knowing like a recommendation for or something like that, we do have a component of the study that is trying to understand the skills and competencies that home visitors may need. And at first, that was in the pre-COVID world of, you know, what do skills and certifications in higher ed look like in supporting this workforce? But now, as you said, the new normal is really going to have some component of virtual home visiting. So one of the things we want to dig into as a result of what we learned from this full workforce survey is what are those skills, like how are the skills and competencies changing, evolving, whatever they may be, to support this virtual component of home visiting. And in addition, we're hoping to maybe add on some data collection with families to learn from their perspective what skills would be helpful from their home visitor to support their experience and getting their needs met in a virtual home visit. So I could see the idea of having something like that coming out of that, even though we wouldn't be developing what that would look like ideally. But I think those are the types of things that people might start thinking about as this does become the new normal. And in terms of race ethnicity, we did not ask that in this family survey, but a part of this study includes the home visiting supply and demand mapping. And a part of that, both supply and demand, will be capturing the various characteristics of families served by the home visiting program, including race, ethnicity. And then we're also trying to capture the race, ethnicity, and other characteristics of the home visitors to try and get a sense for what does the home visiting workforce in California kind of look like? Who are they compared to the families that are being served, or the families who might be requesting home visiting, since the demand is going up.
And I just want to point out, commissioners, that this next phase of this study, this initial phase of the study is going to inform the next phase where they're actually going to attempt to saturate the home visiting workforce field. And they're working with our First Five Association, DPH, DSS, to try to have every home visitor and supervisor respond to their survey. I mean, every. So to that extent, it's a short timeline and a very deep and ambitious lift so that we can, because then the results are truly just, so this is really preliminary findings that are, I think, quite telling, but we are informing this next phase. So just so you know that this is going to come rather quickly.
The toolkit for caregiving and home visiting has just expanded exponentially. That pretty much every care site in America is now doing it. Most of them didn't. They're all doing it now. And there's a bunch of different tools that they're using, and they're getting better at it. And the next generation of tools is going to be even easier to use and better to use. And so I think this is going to be an expanding area, and it's going to be much easier to do. And it's going to be easier to do with tools that are really easy for the patients and everyone to be part of. So this is really, it's the right time to be doing that. And on the care side, when you do the patient surveys, the majority, literal majority of patients say they do not want to go back to going to doctor's offices and for their visits, because why do you want to drive across Town Park, go through all the hassle, if you can literally get your doctor on the phone now? And get you can either get it asynchronous with feedback and text, or you can get it live with the video, and both of them are much, much easier than going to any physical office. If you don't have to draw blood or don't have to do something that actually involves touching people, care in America has just changed totally. And Medicare, thank goodness, stepped up to the plate at the beginning of COVID and said, we're going to drop all of the old restrictions that we had in that space. And they used to be the major barrier, and they kept most care sites from going down that path. And because they were afraid that they would get way too many visits if they paid for them. But because they had to do it, Medicare dropped that and flipped over instead to facilitating it and then creating a different payment level for it. And so Medicare is now on board with it. And so the world has changed in this space. So when you do the next time you do the survey, you might be doing the survey about a different tool.
I just wanted to add that we were very intrigued by how many of the visits were happening on the phone, both the video visits also on the phone. And so we're really curious about the difference from the experience of doing a video call on the phone versus a computer. So we may follow up and try and ask about that too.
People like it a lot. The other area, the mental health, the coaching and counseling stuff, both the coaches and counselors and the patients seem to much prefer the electronic version. And the only exception to that is the really low income homes where the person can't get any privacy of any kind in their space. And so it's pretty hard to talk to your shrink about your problems if everybody in the family is listening.
Yeah, and we actually did ask the home visitors in these interviews about whether they had privacy concerns doing these virtual home visits, and many of them didn't have very many concerns. They actually had received some training on maintaining confidentiality in virtual visits. And we didn't explicitly ask that of families, but we asked, oh no, we did. We asked if they had concerns about confidentiality and privacy, and actually 0 of them said that they did. But some of them did have concerns about being interrupted, which I think could compromise confidentiality, even if the families didn't recognize it. We didn't look at that chart, but we did ask the families that.
Right, and on, yeah, exactly. Okay.
Can't hear you, Myra.
Any other, Myra?
I think Myra's trying to talk.
Myra, we can't hear you. Wave.
Well, can I stall for her for one? I'll give you some time. Just 2 other thoughts. You mentioned, again, emotional support being a huge component of the benefits here. And I was just wondering if, as some of the resources that, you know, providers or the workforce that they were giving, are there any opportunities to redirect or as an added support, send families to group sessions, like group virtual sessions? Because now that really seems to be on the rise. These convenings, these virtual convenings where they may start out as large groups, but they go into breakout groups relative to the individual's experience, really around trauma-informed care and just trying to make, so is there any linkage or any possibility of linking folks beyond that individualized support?
Maybe. I think that's a really great question, and possibly something, if we do that later qualitative data collection with families on their perceptions of home visits and skills and things needed, that could be a component of that. What other form could virtual visits take, and see if that group aspect would seem beneficial to them. This did come up with home visitors actually from our advisory groups, the idea that home visitors getting together in groups for peer support and community supports, of course. And that's something, that idea and other ideas around supporting home visitor mental health and retention in their programs and in the field will be explored in that way, but it's an interesting idea for families too.
And if I might just add that the coordination funding that Camille mentioned in her opening remarks, where we have 51 counties participating, part of their work is to get with the other home visiting agencies, implementing agencies in their county, and determine how to best serve families in a more coordinated way. And so part of the recommendations that come out of this, or the findings that come out of this study, will be mirrored in their coordinated implementation at the local level, and we will be bringing you the results of local efforts to increase coordination and serve families. And so we can bring that recommendation to our coordination group, and then potentially talk to them about that, and then we might actually learn something about it in this other study. So two things going on simultaneously.
Yeah. And First Five's investment in this, our investment was to do this study so we could understand future workforce needs.
Yes, to understand who our current workforce is and how do they map onto the family needs, the needs identified by the population of families who are eligible for the CalWORKs Home Visiting Grant. And what we know is there's a lot of unmet need out there. And so part of the work that Child Trends will be doing is disaggregating the results by region, by type of home visitor, like the nurse, the social. It's just trying to take a look at a regional, local, statewide level about where are the gaps in meeting local family needs, and where do we need to have an infrastructure? Where could we invest in an infrastructure that can better support a pipeline of home visitors to make sure that we are able to ensure that every family who needs or desires home visiting and qualifies for home visiting can access home visiting. And so I don't know if Daniel wants just 2 seconds on the advisory committee, who is helping you to steer the direction of this. Chris has actually been interviewed as part of this, and I think Myra, you were as well.
Can you hear me now?
Yes, sorry about that.
Okay, great. I just wanted to applaud the scope of who the definition of a home visitor is. And thinking about I don't know if I'm on the advisory committee or if there's another committee that I'm on.
You helped us with the policy aspect, yeah.
Policy subcommittee, that's what I'm on. We had a really important discussion about who qualifies as a home visitor. And I think there is this important movement in early childhood and health and other sectors of lifting up community members as a vital part of the workforce and validating that experience. So I think this study isn't only going to help identify the future workforce for home visiting, but give us important data for what does the community health workforce look like? What are the core competencies that it needs? So that as California looks to adopt and hopefully support a community health workforce integration, that we have a really important model information about how that model works in the early childhood space. So I was really encouraged by that and wanted my fellow commissioners to know that the scope of that, of what a home visitor is quite broad.
And I think we also had some early thoughts, and correct me if I'm wrong, Camille, but just also as we're thinking about that future workforce, making sure that it didn't have unintended consequences on the ECE workforce. And, you know, maybe because they were going to make more, it would, and those are the competencies you were looking for, it was going to drain the ECE workforce or any other. Is that right? Did we talk about that?
Yes, and it's part of their scope. It's part of their scope to, as they do some of that competency mapping that they're looking to do, skills of the workforce, also taking a look at the unintentional consequences of other fields. So that is part of that middle section of their work. And we remembered your input and made sure to include it.
And just, I think Debbie, you mentioned the core advisory group. So in those slides that you also received in advance, in the notes for slide 7, that talks about the core advisory group's role, there is a list of all the participants. And the goal is really to have this work be guided by those thought leaders who can provide this higher level guidance so that we give products of the state that are actually actionable, practical, and relevant. And then we have these subgroups like the one Myra mentioned, specifically around shaping policy recommendations.
And I just want to let you know, I didn't send you their notes from their PowerPoint slides, but if that is something that you would like to receive, I'm happy to send the raw information to you. I sent you the slides so you could follow along, but if you would like the notes, I'm happy to send them along.
George, we have one, if commissioners don't have any more questions, we have one public comment as well.
Okay, and any further commissioner questions? Okay, let's go to public.
Francine Rod.
Good afternoon, commissioners. I'm Francine Rod, Executive Director for First 5 Monterey County, and we're proud to be one of the counties that is participating in the home visiting project that Debbie was talking about and that you've been hearing about, the workforce study. I wanted to thank you all for that opportunity and to support some of the notions that have been brought up today. One of the things that our home visitors are finding has been really challenging is the digital equity divide in terms of actually being able to connect with those families. And home visitors have been known to drive and sit outside of a family's house to be able to allow them to use their mobile hotspot. And so in terms of ensuring that piece and working at the statewide level to really get an infrastructure in place so that we actually have cable laid everywhere. We have situations where a person in one house will be able to access internet from this provider, and 2 doors down, there is no provider. And so it is quite challenging for families to be able to access these types of services and supports in addition to having the devices. So those types of equity issues are something that I would want to lift up for possibility for future. You can't afford the investment in the cable, but in terms of pressing for the statewide work that happens there, which now we're seeing is needed in the ECE community as well, and for our families to be able to access those Maslow's hierarchy of needs that they also need, is something that I feel would be really important for it'd be great for the commission to help to support that type of work. We're also really excited about the triage aspects of the hub, where we also, in our county, we have Nurse Family Partnership, we have Head Start, we have all of these different home visiting models. And by being able to support a family with knowing what their needs are, we can connect them to the most important resource for them, whether or not it's more expensive models, whether or not it is a group model, to your point, Jackie Majors, that we can then make sure that we're meeting them where their needs are. So we really appreciate your investment in this project, and we look forward to working with you as we move forward. Thank you.
Thank you.
Thanks, Francine.
Great.
George, I don't think we have any other public comment on this. Oh,
okay.
Hold on. Nope.
Nina just raised her hand.
So there is one more. Just raise their hand. Nina Machado?
Hi, Nina Machado with First Five Amador. I'm not going to put my camera on for exactly the reason that Francine mentioned, because I will lose my connection. But just wanted to thank you. This is actually some excellent information. I already wrote down some ideas based on some of the conversation, which is always very exciting. You know, one of the things that we've really seen in Amador is participation with the virtual home visits by two parents being in the home. So that has just increased tremendously. And also grandparents and aunties who, I mean, it's just something that we hadn't seen as much, but it really became significant during the pandemic. And I love the idea of moving to the virtual meeting opportunities for individuals and thinking about how we can even do that, maybe even across the rivers with some of our other, you know, county partners, because sometimes people are even more comfortable when it's not somebody in their own neighborhood that they're having that meeting with. So thank you so much for this information, and look forward to working more on you with it.
Thank you.
Thank you.
I also want, we've covered a wide range of topics here, and so I just want to give Sarah and Rachel one last opportunity to add anything that might be important or that I might have missed. They're shaking their heads no.
Okay, good. Thank you. Good report, good information, very useful, and work in progress. So you're going to continue to scout this out and become wiser and smarter in this topic. So good.
And reports will come out regularly, and we anticipate the first report coming out next month prior to the completion of the, we heard you, Chris, a year ago when we came to the commission with this item saying that you wanted to make sure you had something by September for the master plan, and they do have a report due next month and have an advisory committee that's helping them to shape that. And several advisory members are on the master plan group. So we are working to make sure that you have the information that you need.
Great, thank you. Okay, that is there any other public comment on this, or can we go on to the next topic? All right, Camille, take it away. Camille, are you there? Did we lose Camille?
Sorry, they muted me. It's something that they like to do on you know, a regular basis, but they decided to let me talk for a little bit. No, commissioners, if you'll recall, at our last budget retreat, we had a request from our county partners to come back to you and give us a presentation about the work they're doing and how that fits in with our work together. So today we are fortunate enough to have several executive directors from across the state, along with Melissa and others, to present to us. And I have to say, everyone has worked very hard to put this presentation together and worked with us. So we're excited to see it. And we also have a parent participating who we have engaged a translator for. And I've been asked to all the presenters that are going to be talking to us, if you'll slow it down just a little so the translator has the opportunity to translate into Spanish to the parent, who will be presenting a little while later, but who's also going to be listening. So Melissa, I'm going to look at you, and are you going to, yes, Melissa's going to kick this off. And so commissioners, I turn it over to our partners at the First Five and First Five Association.
Thank you, Camille, and thank you, commissioners. We really do appreciate the opportunity to share with you today about some of the work that's happening locally on the ground and bring that perspective. And I think we really actually feel it's incumbent upon us in being good partners with First Five California and the State Commission to do that so that we can marry those perspectives in our work together. So thank you for the opportunity to do that, and hope it's something that maybe we can continue to do in some way ongoing. So I'm just going to do a little bit of stage setting for you to hear from 3 First Five local leaders and a parent, as Camille described, talking about the evolving roles of First Five in their communities and some of the goals and principles that underlie our work at the local level, as well as our shared work in partnership with First Five California. So I think, Erin, are you controlling slides? We can go forward a couple.
Yes.
There you can see our presenters for today. This is perfect if you don't mind staying here for just a moment. So as you all know, First Fives really play a critical leadership role in their local communities. Wanted to highlight a few aspects of that as you prepare to hear from the local leaders. One, of course, is really bringing their voice to ensure that young children's well-being and a focus on prevention are prioritized. Several First Five leaders have noted to me that they are the voice at the table for children 0 to 5 and their families on a wide range of local issues and efforts. Also the work with public agencies and community-based partners and communities and families to connect siloed systems of care, really bring partners together in intentional, integrated ways. And that gives the local First Five the role and the opportunity to hold the vision of how systems can be rethought and built to have greater impact and positive outcomes, really with the strengths and needs of families at the center. And what this has really led to in a way is First Fives as the backbone among agencies and delivery systems in their communities. And that cuts across many programs from early detection and intervention, home visiting, healthy birth outcomes, COVID response, which you'll also be hearing about today, early learning. But I think this backbone role where the local First Five is focused on building systems and transformation of systems, working together with partners to ask those hard questions and do that really challenging work of systems change and sustaining that change so that we can more effectively not only meet the needs, but really move forward on our shared goals for children and families. So that critical anchor role in their communities. I know you also know that First Fives are funders of this work at the local level, but they're also co-architects of the work to continually adapt and ensure that we're building systems and programs that best serve the needs of under-resourced and disinvested communities. And you'll be hearing more about some specific examples of that as we go forward. So maybe the next slide, if we could. Local First Fives work and our partnership with First Five California through the network is anchored in a strong vision and a commitment to the mission and core principles. As I noted this morning in my remarks earlier today, we have a co-created vision in the network with First Five California, the local commissions, and the First Five Association that one day California's success will be measured by the well-being of our youngest children, and the focus on our mission that every child in California will be safe, healthy, and ready to succeed in school and life. And you can see on this slide the 4 principles that guide all of the efforts and the implementation of the work to try to move us toward that mission and vision. Whole child, whole family, integrated services, equity, and prevention. And we used this framework of the vision, mission, and core principles when co-creating with First Five California our letter to the Early Childhood Policy Council, sharing our thinking on the master plan. And I believe a copy of that letter is in your agenda packet and goes into these 4 principles in greater depth and detail than I'll do right now. Next slide, if we could. We also wanted to highlight the framework of targeted universalism that we know many folks are familiar with and that comes to us from John A. Powell of the Othering and Belonging Institute at UC Berkeley. I think it really captures the approach of the First Five Network and the ways in which we can work together to advance our shared principles and goals. The idea behind targeted universalism is that we can set broad universal goals. For example, every child will be ready for kindergarten. And then we can build targeted strategic efforts to achieve them that are grounded in the varying issues, strengths, and needs of communities and different groups, and grounded in data that helps us understand the distance from the universal goal for various groups and some of the accelerators and barriers that could move us toward that universal goal. Professor Powell refers to targeted universalism as equity 2.0 because the framework is a way of putting equity into practice and recognizing that people are situated differently. So it's not just about reducing disparities between groups, which is also important to do, but it's really about building on our shared values to ensure that we are moving forward so that all children can achieve the universal goals that we share together in terms of preparing them to thrive and have the fullest opportunity to succeed in school and life. And I think it particularly is acknowledging the supports that are needed to make sure that the most marginalized groups have strategies that make sense for those groups to move us toward the universal goal. I also really appreciate that Professor Powell notes that it reminds us all that we are all part of the same social fabric as we move toward those universal goals. So we see this framework of universal goals combined with targeted approaches to reach them as providing a strong base for the working partnership between the State Commission, the Association, and the local commissions to advance equity. Next slide. So we wanted to just share this as an example of what I was talking about a moment ago, that as part of this work around targeted universalism, First Fives are already using data to guide and shape their work to reach the most underserved children and families. And you can see on this slide some of the examples of the kinds of data that they are using to ensure that strategies and resources have that targeted approach moving us toward universal goals. One specific example I'll share is that First Five Alameda has developed an equity index and is using the findings from that to shape their funding decisions and provide tiered support to school districts across the county who are partners in improving kindergarten readiness. So I think this this approach, by using a variety of data sources and different data points, may be more useful or make more sense in different communities, but that we all have in common is the approach of using data to focus our investments where most needed at the local level. And I think that's a really powerful aspect of how First Fives work. We can tailor to local needs while across the board focusing our interventions where they're going to be most impactful. All right, next slide if we could. So next we're going to hear from 3 First Five leaders and a parent. We will hear from Gina Delighten from Yolo County about how First Five funding is blended and braided into local systems and leveraging other funding sources to have greater and more sustainable impact. We'll hear from Ruth Fernandez of Contra Costa County how First Fives are centering racial equity in their work. And then we'll hear from Karen Scott from San Bernardino about how First Fives have continued to meet local needs in the context of COVID-19. And then wonderful that we will hear from a parent, Ms. Espinosa, about her experience in working with her local First Five and efforts in the community. So I'm going to start it off by turning it over to Gina.
Thank you, Melissa. Hello. My purpose for the next few minutes will be to talk to you about how First Five California funding is used to support local systems building. Many, if not all of us, have turned our local strategic plans to address under-resourced children and families, focusing more deeply on higher impact systems efforts rather than sprinkling funding across a number of more siloed programs that might interact but are not truly integrated. You may be very familiar with County First Five work, coordinating multiple funding streams into a quilt of funding to wrap programs and services around children and families. Did you know, though, that increasingly, even at medium and smaller First Fives, funding from multiple sources is carefully braided to support sophisticated, higher impact initiatives that reach beyond systems improvements to create true systems transformation? The simple quilt has become a complex tapestry of programs and services woven together to allow a whole child, whole family approach that crosses generations, fuses health, safety, and early learning goals. This more intricate systems work requires us to strategically braid and weave investments from the state, from our county, and additional public and private sources. Within the context of defined and shared goals, First Five California is often a key partner in that work. Flexibility and predictability in funding streams is required for our work that is at once increasingly complex and increasingly meaningful. And removing any one of the tightly woven components, including funding pieces, can fray and unravel that tapestry. So in Yolo County, we now have 3 main initiatives, and all 34 of our program contracts revolve in and around these 3. And I'm going to share a glimpse of just 2 of them with you right now. First Five YOLO's largest initiative, the Child Project, Road to Resilience, is designed to use an administrative data screen to identify highest need and open access to intensive services during the perinatal period. The project incorporates 3 different models of evidence-based home visiting, establishes a central point of coordination, integrates and fuses medical and social services, and addresses early learning, family strengthening, and health in a county-wide systems transformation effort with more than 10 partner agencies. Its annual nearly $1 million budget, and that's a big number in Yolo County, is jointly funded by Office of Child Abuse Prevention, First Five Yolo, local cities, County of Yolo, and small private funders. Together with our direct service agencies, First Five Yolo is project architect and program collaborator, as well as a funder. Coming this fall, the Child Project Road to Resilience will be a key partner in your home visiting coordination efforts, with the direction of the grant helping to advance the mission of our project. Some of the families in this project will also be served by your dual language learner pilot in our county. So secondly, First Five YOLO is lead agency for QCC Impact. And I want to thank you, the First Five California Commission, for your emphasis on family, friend, and neighbor providers. Our largest investment in impact over the next 3 years is with family, friend, neighbor providers, many previously invisible in quality efforts. It was this new planned focus, planned pre-COVID, that positioned YOLO with a team of community coaches, culturally and linguistically appropriate, to serve the non-traditional providers who are now increasingly key in the support of families disproportionately affected by the COVID-19 emergency. Our dual language learner grant will rely on our impact network to identify providers for DLL professional development and families for COVID-related supports, access to electronic devices, internet, and books. First Five YOLO will blend in county CARES funding and funds from a Packard Foundation grant that's also focused on FFN providers to augment this work and to fill gaps. Impact quality work will include COVID safety training specifically focused on the disproportionately affected Latinx population in Yolo County, in concert with local health data and bolstered by our CARES funding. So with this very brief snapshot from YOLO, I hope you see the critical nature of the First Five California Commission's partnership in all 58 counties. The more flexible and predictable you can make your funding, the more strategic we can be in our work on the ground. We can maximize the benefit of multiple funding streams by weaving them together into more intentional and more advanced systems work. In closing, I would like to recognize the outstanding effort by your staff in this regard, particularly the recent work by Debbie Silverman to craft the home visiting and DLL grants to align with local efforts. As we face unprecedented challenges during the pandemic, our work strategizing around shared goals has become even more urgent. Thank you for your time and your attention, and thank you for your continued partnership in the First Five Network.
Thank you.
I think we're going to hear next from Ruth Fernandez in Contra Costa.
Good afternoon, First Five California Commissioners and First Five staff. It's my pleasure to speak to all of you today, and I will be speaking about how First Fives are centering racial equity in our work. And I would like to start my remarks by underscoring why this work is essential and central to our vision. First Five California has a vision that California's young children receive the best possible starting life and thrive. In helping to lead the movement to create and implement a comprehensive, integrated, and coordinated system for California's young children and their families, we work so that all children are healthy, ready to learn, and supported in safe, nurturing communities and families. However, we know that not all children have access to the same opportunities. And this access has been shaped by the racist policies that have systematically drained resources from communities of color for the benefit of white communities. This uneven distribution of resources has created many disparities, and these are prevalent especially now during our COVID pandemic. For example, Black and Latino families are more likely to experience housing insecurity and struggle to make ends meet because of racist policies like redlining, limiting their ability to purchase homes and accumulate wealth. Neighborhoods, healthcare, schools, businesses, and the residents and families that rely on these institutions have all been molded by racist policies like these. Because of the far-reaching effects of these racist policies, reckoning with structural racism and taking an active anti-racist approach to our work is not only integral, but an ethical imperative to giving all California's children the best possible starting life. So in Contra Costa County, this call to action to actively take on an anti-racist approach became clear in 2017 when we embarked to conduct on a kindergarten readiness Contra Costa study. The study underscored how important well-being is to children's readiness for kindergarten, and that well-being is closely tied to the social determinants of health related to housing, food security, and economic security. We know that racist policies like redlining have shaped these social determinants of health for Black and Brown communities. So it's no surprise that the study revealed that a disproportionate number of African American young children were not ready for kindergarten. So in order for us to understand the systems and policies that created the disparity, and also to reframe and increase school readiness, we launched an initiative called Ready Kids East County, and we're really excited about it. With our Ready Kids East County, we're taking an ecological approach to this work. What we mean by that is that instead of asking whether a child is ready for kindergarten, we are asking, are schools, our communities, and our families ready for kindergarten? So we can begin to reimagine a system that prepares all children. We view school readiness as a shared responsibility of the child's ecosystem. Our work for Ready Kids It's not just about what we're doing, but how we're doing it. Alongside community leaders, schools, and families, we are exploring the definition of kindergarten readiness and all the factors that affect it. That means that we're not setting the agenda. Instead, First Five Contra Costa is creating spaces where community members can come together, learn from one another, and build on their collective power to identify solutions and make change. From this learning, we hope to co-design interventions that get at the root causes of kindergarten readiness, grounded especially in the wisdom, knowledge, and creativity of the community members and families. We believe that we are well positioned for this work. First Five Contra Costa can organize the work of Ready Kids this county because our strategic priorities are focused on creating high quality coordinated systems of care for young children. Our early childhood education and early intervention initiatives already have us working in coalition with organizations and agencies across the county. Both of these initiatives are leading local collaborative work to elevate the quality early learning of programs and also doing ACEs work countywide. We are embedded in communities, and so our First Five centers across the county are focal points to families and parents so that we can deepen their community ties and decrease isolation. And our 3 parent-led regional groups build power among underrepresented communities and advocate for policies at the city, county, and state levels. Their advocacy will benefit children and families across the county. And you will hear from one of our parent leaders later today. In addition to our relationships and experience, we're privileged to be able to leverage Prop 10 funding in powerful ways for work that centers racial equity and systems change. Ready Kids this county is jointly funded by Prop 10 funds and a 5-year grant from the Dean and Margaret Lesher Foundation. One stream of funding alone, we know, would not be able to facilitate the deep community partnership that this initiative requires. But like Gina mentioned earlier, we're in the unique position to do even more for communities than funnel Prop 10 dollars their way. Because of this position, it is our imperative to do more than just mitigate the effects of racial disparities. Without interrogating why those disparities exist and the policies and structures that made them so, our vision for our county's young children to be healthy, ready to learn, and supported will continue to stay beyond our reach. We look to truly uproot the systemic racism that causes inequities to persist. I really appreciate the opportunity to speak with all of you about this topic and to share how excited we are as we learn and embark on this work moving forward. Thank you.
Thank you, Ruth. And now we'll hear from Karen Scott of San Bernardino.
Thank you. Good afternoon, First Five California Commissioners and my First Five Network colleagues. I'm going to talk a little bit about how First Fives have continued to meet local needs despite COVID-19. As Melissa and others have stated, First Five provide critical leadership to our local communities. First Fives weave and hold a unique relationship building role, much like a quilt within our counties, and we nurture those relationships, especially with public, private, nonprofit, and philanthropic partners. First Fives are trusted local messengers, backed with more than 20 years of experience and data to guide our leadership. First Fives are nimble, responsive, and continually adapted to ensure what we build will best serve the needs of our communities. First Fives have been able to continue to meet local needs despite COVID-19 because of these relationships. The central core of First Fives' work has not changed due to the COVID-19 pandemic. Although delivery of services and support might look different, the effort to continue serving the most vulnerable has persisted. Everything that is being done in response to COVID-19 still reflects the mission and values of First Five, supporting the whole child and the whole family. First Fives have continued to make deep connections to on-the-ground supports and services across multiple sectors, and throughout the state stepped up in many different ways to meet the needs of their communities during COVID. I want to share firsthand what that looked like in San Bernardino. So as we know, childcare stabilization has been the greatest challenge for First Fives during COVID-19, and childcare access has been the greatest issue for our families and providers. Commissions have responded to the need with unbelievable expediency in many ways, including becoming emergency service agencies and leveraging additional community support to ensure providers stay open. In San Bernardino County, childcare providers frequently reached out to us, First Five, for guidance about having to shut down, when they could reopen, how they could receive operating support through emergency COVID-19 funding, how they could receive emergency supplies, and even safety training. First Five San Bernardino was able to work with our local R&R and ensure that every inquiry was answered and needs met to the highest degree possible. And we did that collaboratively. First Five San Bernardino contributed $25,000 to a COVID-19 Rapid Response Fund, which was a collaborative philanthropic effort with our local partners such as Funders Alliance and the Community Foundation that helps serve nonprofits, such as our childcare providers, who were serving essential workers and vulnerable populations of children. These providers were able to apply for and receive grants and/or stipends to help in any way needed. As you know, First Fives also partnered with childcare resource and referral agencies, local childcare planning councils, city and county departments, foundations, family resource centers, superintendent of schools, and others to quickly mobilize and ensure speedy allocation of the supplies provided by the First Five California Commission. In San Bernardino, we worked with our local R&R, Child Care Resource Center, called CCRC, to identify the need for these supplies, which were so appreciated from First Five California. CCRC conducted surveys with providers to determine the immediate needs. We then mapped out the landscape in our huge geographical region of 20,000 square miles. We determined the transportation, the delivery, the storage space resources. We developed a plan for packaging the supplies, boxing them up, labeling them, and then notifying our child care recipients that they would receive these, and scheduling and conducting distribution events in several locations throughout the county. Our distribution used a drive up and drop method to ensure the safety of all. So we were masked up, you had a time that you drove through, open your trunk, drop in the items, and away they went. So again, thank you First Five California for that resource. Knowing that parents are experiencing high levels of stress due to economic uncertainty and concern about their own and their family's health and well-being, all while attempting to tend to their children's needs, like you, we are concerned about the probable increase in child abuse, intimate partner violence, and substance abuse that comes during times of crisis. In response to the elevated numbers of suspected child abuse cases we began seeing almost immediately in San Bernardino County after the stay-at-home orders were given, and also because of the egregious nature of these cases, as children aren't being seen in schools and other areas, all of these cases were identified in emergency rooms and hospitals. First Five San Bernardino worked closely with our Children's Network, which is the child abuse prevention leader in our county, and our Children's Assessment Center, the one-stop center serving children having experienced suspected child abuse. And we're working to hire a forensic pediatrician that we would fund to help complete the backlog of forensic interviews to ensure justice for these child victims, to train pediatricians and providers on how to identify potential child abuse, and to implement county-wide information campaigns identifying resources and connections for vulnerable families. By adapting our approach to serving the community, mostly via telehealth and home visiting, First Fives have been able, and virtual home visiting, First Fives have also been able to maintain these critical connections with our families, even in hard to reach communities, and also to support coordinated systems of care to ensure families feel heard and cared for. In San Bernardino, our adapted approach was used related to our DTI local dental pilot program, where we could maintain relationships with families needing oral health assessments, oral health education, care coordination, and establishment of a dental home, all through virtual platforms or by phone, email, mail, etc. We also adapted our approach and continued serving families within our AmeriCorps PATH home visitation program through virtual visits. The families reported being very comfortable and well served in this approach. And like I heard earlier in a presentation, we too were surprised by the opportunity to have maybe both parents be on the call and the likelihood that we had a greater attendance, a greater show record for these virtual visits. So as we continue to ride out the storm of COVID-19, First Fives across the state are committed to quickly and continually identifying where we can step in to support our young children and families. We are focusing intentionally on prevention, coordination, and integration efforts to support and sustain our collective work, and we are wrapping our children and families in our funding quilt to ensure all measures are taken to help them succeed in life. Thank you.
Thank you, Karen and Ruth and Gina. And now we're very fortunate to have a First Five parent with us from Contra Costa, Ms. Tomasa Espinosa. Thank you so much for being here with us today.
Will somebody, sorry, I'm Cecilia, I'm with First Five Contra Costa and I'll be interpreting. I'll just wait for the PowerPoint.
Le voy a poner pausa a usted. Bueno, creo que ya me escucha. Sí, permíteme que yo le bajé todo el volumen.
Sorry, she's getting ready. She was listening to interpretation, so she's putting it away.
Ok, ya. Hola, buenas tardes a todos. Mi nombre es Tomasa Espinosa y soy la vicepresidenta del Grupo Regional del Oeste del Condado, patrocinado por los Primeros 5. Junto con nuestros dos grupos hermanos del Oeste del Condado, nosotros del Oeste, del Centro y del Este, somos un grupo de padres activistas que luchamos por comunidades saludables, seguras y equitativas para los niños pequeños y sus familias.
Good afternoon, my name is Tomasa Espinosa and I'm the co-chair of the West County Regional Group sponsored by First Five Contra Costa. Along with our two sister groups in Central and East County, we are parent leaders who advocate for healthy, safe, and equitable communities for young children and families.
Yo vivo en Richmond y he sido una madre voluntaria junto con mi esposo y mis 3 hijos en este grupo ya casi por 10 años, junto con el programa de participación y activismo comunitario. Con los Primeros 5 hemos transformado nuestras comunidades y las vidas de miles de familias, incluyendo la mía. Gracias por darme la oportunidad de compartir un poco sobre mi experiencia y nuestro trabajo.
I live in Richmond and my husband and I, along with our 3 children, have volunteered with this group for almost 10 years in collaboration with the Community Engagement and Advocacy Program with First Five. We have transformed our communities and the lives of hundreds of thousands of families across Contra Costa, including my own. Thank you for giving me the opportunity to share a bit about my experience and our work.
Bueno, la pandemia desestabilizó a nuestra comunidad. Solo nuestro programa, 75% de las familias perdimos nuestro trabajo. Mi esposo, por más de 4 meses, no tuvo trabajo. Junto mucho con otros estábamos aterrados de que nos echaran a la calle con nuestros hijos y de que pues no íbamos a poder pagar la renta. Mis hijos también estaban muy estresados y ha sido muy difícil esto. Pero aún así no dejamos de luchar por nuestras familias. Nos reunimos con los funcionarios electos, nos movilizamos y dimos testimonios en reuniones virtuales de la Junta de Supervisores y con los consejos municipales para aprobar moratorias a los desalojos y aumentos de alquiler. Trabajamos muy duro y finalmente logramos aprobar 6 políticas en 6 semanas. Esas protecciones ofrecen un gran alivio para mi familia y miles de otras familias con niños pequeños.
The pandemic has destabilized our community. In our program alone, 75% of us lost our jobs. My husband was without work for over 4 months. Along with many others, I was terrified of being put out on the street with our children since we couldn't pay the rent. My children also feel distress, and it has been very difficult, but it did not stop us from fighting for our families. We met with elected officials, mobilized families, and testified at virtual Board of Supervisor and City Council meetings to pass eviction and rent increase moratoriums. We worked extremely hard, and ultimately we were successful in passing 6 local policies in just 6 weeks. These protections have provided great relief to my family and thousands of other families with young children. Next
Desde el
slide.
año, ¿sí? Bueno, desde el año pasado también hemos llevado a cabo una campaña comunitaria para promover el censo 2020. Nuestras comunidades inmigrantes, personas de color y familias de bajos ingresos con niños pequeños, enfrentamos la barrera para ser contadas. Y yo entiendo el miedo que hay en mi comunidad para llenar el censo, porque hay muchos ataques contra nosotros los inmigrantes. Para ayudar, yo participé en una campaña de tocar puesta en puesta por 3 ciudades para ser contados. Incluso en medio de la pandemia hemos seguido promocionando el censo por medio de llamadas. Y no solo yo, mi hija adolescente, que empezó en los primeros 5 como una niña pequeña, también ha ayudado a realizar llamadas para el censo. Es muy importante para mi familia ayudar a Richmond y otras comunidades a recibir los fondos y la representación que tanto necesitamos. En total, alcanzamos compartir información sobre el censo con 2,300 familias a lo largo del condado.
Since last year, we have also worked to conduct grassroots outreach for Census 2020. Our communities, immigrants, people of color, and low-income families with young children face barriers to being counted. I understand the fear of filling out the census that exists in my community because there have been so many attacks on us as immigrants. To help with this, I participated in a door-knocking campaign in 3 cities to be sure that we were being counted. Even in the midst of the pandemic, we have continued to promote the census in key neighborhoods through phone banking. And it's not only me, my teenage daughter, who started out as a toddler in First Five, has also helped make census calls. It is so important to my family to help Richmond and other communities receive much needed funding and representation. In total, we have shared census information with 2,300 families across the county. Next slide.
Aparte de haber trabajado en el censo, hemos hecho llamadas para registrar y educar a los votantes. Son importantes las elecciones nacionales, pero también hay muchas otras carreras e iniciativas locales que tendrán un gran impacto en mi familia y muchas más. Además, con el cambio de mandar las boletas por correo, es importante que entendamos cómo funciona este proceso. Me hace sentir muy orgullosa ser parte del cambio de mi comunidad. Y es que yo estoy haciendo una diferencia por nuestros hijos. Hasta la fecha hemos proporcionado información a 930 familias y aún continuamos llamando hasta las elecciones.
Aside from promoting the census, I have also been phone banking for voter registration and education. While the national election is important, there are also many local races and initiatives that greatly impact my family and others with young children. And with the shift to mail-in ballots, it's important that we as families understand how the process will work. It makes me feel so proud to be part of the change in my community and to feel like I'm making a difference for our kids. To date, we have provided voting information to 930 families, and we're still making calls up until the election. Next slide, please.
El Grupo Regional del Oeste del Condado y los primeros 5 han sido un gran apoyo durante esta pandemia, no solo por el cambio político y sistemático, sino también para nuestra salud mental. Actualmente, cada grupo se ve por Zoom al menos una vez al mes y a veces nos vemos más. Cada reunión es importante para nosotros, ya que nos une, nos apoya y nos da razones para seguir adelante y continuar creando cambios.
The WCRG and First Five Contra Costa have been a great support during this pandemic, not only for policy and systems change, but also for the mental health of us families with children. Currently, each group sees each other on Zoom at least once a month and often more than that. Each meeting is so important for us because it brings us together, gives us support, hope, and reasons to move forward and make change.
La pandemia nos ha costado mucho, pero no nos ha parado. El personal de los primeros 5 ha sido un colaborador tremendo. Nos ha apoyado en las buenas y en las malas y nos ha enseñado lo que es una verdadera colaboración basada en la confianza. Nos ayudaron a encontrar apoyo monetario y los recursos que tanto necesitábamos durante esa crisis. Sobre todo, nos recuerda que no estamos solos. Nos llena de gratitud saber que hay un programa que nos hace por enseñarnos y movilizarnos, sino también que han creado lazos de por vida que se vuelven como si fuéramos familia.
The pandemic has been really hard, but it has not stopped us. First Five staff have been a tremendous partner. They have supported us through thick and thin and shown us what true collaboration and trusted partnership looks like. They have helped us connect to cash assistance, resources, and above all, remind us that we are not alone. This program does more than just teach us and help us organize. It creates lifelong bonds and a sense of family.
Esto es un poco de lo que hacemos como padres líderes de los grupos regionales. Si quieren saber un poco más acerca del trabajo que hacemos, nos pueden seguir por Facebook para aprender más sobre todo el trabajo que hacemos en la comunidad, que es mucho. Gracias por escucharme y darme su tiempo y hablar acerca de nuestra historia. Y sobre todo, muchas gracias por su apoyo a nuestro movimiento comunitario. De verdad, muchas gracias.
This is just a little bit of what we do as parent leaders with the regional groups. Please feel free to follow us on Facebook to learn more about the great work that we do. Thank you for listening to my story and for your support of community-led movements to build healthier, safer, and more equitable communities for our children. Thank you.
Thank you.
I don't know if anybody has questions for Tomasa or...
Any questions? Who has questions? Anybody?
I have a question.
What's your question?
Myra has a question.
Let Myra
Gracias,
ask a
Tomasa.
question. Go ahead.
Gracias, Can you hear me okay? ¿Me oyen? Okay.
Yeah.
Gracias, Tomasa, por su presentación y por estar aquí con nosotros. Le agradecemos mucho su tiempo. Ya sabemos que como mamá están muy ocupadas. Muchísimas gracias. Una pregunta para usted es, ¿cómo aprendió de este grupo? ¿Cómo se conectó con el grupo? ¿Cómo supo que era algo donde quería pasar su tiempo? Quiero saber un poquito de la historia de cómo se conectó con First Five Contra Costa. And I asked her, I'm very curious, as a mom, she's very busy, strapped with time. How do you get connected to a First Five Contra Costa? How do you even know about it? And how do you know that it's worthy of your time, given how strapped they are every day?
Ya, mira, yo comencé a ir al centro de los primeros 5 por las clases que ofrecían. Mi hija mayor tenía como cerca de los 2 años. Ahora tiene ya casi 15 años. Entonces, ahí una mamá me contó que estaba este grupo que se reunían una sola vez al mes y lo que daban era como empoderamiento de los padres. Y yo, siendo inmigrante y no sabiendo mucho del sistema, dije, como que eso me interesa. Y realmente me ha encantado porque no solamente me ha ayudado a poder crecer como madre, siento que mis hijos les ayuda muchísimo. Mi hija mayor ahora ya también es parte del grupo, ella ha sido parte de los SSI de la escuela, porque ellos han crecido conmigo viendo todo este cambio político. Mis hijos han presentado en los concilios municipales y yo soy de las mamás súper orgullosas, así como pavo real, diciendo, wow, todo lo que este programa me ha ofrecido es muchísimo. Hemos crecido en los primeros 5 de una manera maravillosa, porque a los padres inmigrantes, aún así, yo sé que yo tengo voz y que me pueden escuchar. Y que aunque muchas veces solo hablo español, ahora tengo hasta mi propia hija que me traduce. Y es un logro grandísimo para mí.
Pues felicidades, muchísimas gracias. Ojalá que todos podamos ser como usted.
I can try and interpret what the best I can to all that. She said that she started by attending the First Five Center when her oldest was around 2. She's now 15. So that's where she met another parent, where this other parent told her about the community engagement program and the regional groups and how they were helping her build leadership. So as an immigrant parent, she was very interested in building that leadership. Now she feels very proud that her kids are part of it, that they've grown in the program, that her kids have now presented at city council meetings, that they're leaders in their schools. And she feels like the proudest mom ever because she's also growing leaders. And so they do a lot, and she just feels now that she has a voice and that her opinion matters as being a parent leader with the regional group.
Lovely. Thank you. Thank you. Thank you.
I think somebody else had a question, or was that it?
Other questions?
I didn't really have a question. I didn't have a question. I just wanted to stand up on my chair and wave a napkin. Hooray, hooray, hooray. I loved that presentation. I thought it was fantastic. I loved the themes, the different themes. We got a good picture of the different ways that the First Fives hold up families and children in our state. It was very thoughtfully put together. I loved hearing from Tomasa. It's wonderful. It was just very, very inspiring. And I thank you very much for that.
Yeah.
¿Estabas escuchando la interpretación, Tomás? Were you listening to interpretation? Yeah. Okay.
Yeah.
Thank
Other commissioners, or I just want to thank all of you for taking the time to put all of this together, for the hours. I know that you've talked about what to present and how to present it, and for the magnificent job you did in telling the First Five story from several different angles. So it's always good to see you, my friends, as I look around and think about the work that we will continue to do together. So I don't think.
Thank you, Camille, for the opportunity to deepen our partnership by sharing this work with the Commission today. Really grateful for that opportunity. And I particularly, of course, want to thank Tomasa and Cecilia for doing the really important work of bringing Tomasa's experience to us today. So thank you to both of them.
Thank you.
And our First Five leaders, of course. But thank you, everyone.
George, we have no public comment at this point.
Okay, we have no public comment. Thank you. Really, really great presentations. Very informative, inspirational. Thank you. Much appreciated. That takes us to our final agenda item, and that is the state and federal budget and legislative update. Interesting times that we are living in and about to go into. Take it away.
We're looking for Alex. We know she's in this mix somewhere, so we're bringing her up.
She's nearby.
Here she comes. Yeah, she's coming.
How are you doing?
There she is.
Really is fascinating times. The people in Washington, both sides are convinced they're going to win, and a lot of energy going on. One of the things that's going to happen is, regardless of who wins, and I personally lean a little bit toward the non-incumbent winning, but the incumbent could win because his people are all going to show up to vote, and that's more than half of 60%. But it's all anyway. But be that as it may, what's fascinating is that Medicaid, both sides really expect to have Medicaid be a huge part of healthcare for this country going forward. The Republicans, if they get in, believe that they have to do universal coverage of some kind. And so they've decided that, and they hate Medicare for all as a single payer, but they like Medicaid for all. So there's a high likelihood that that will be a major player. And the other side really wants to make a difference too. And so if we do good things right now in Medicaid in California relative to a couple of key areas, like getting books to kids, but like doing early education, we actually will set a model that the rest of the country will lead. And I've talked to some of the people who run the National Medicaid Association, and they really, really want a working model that they can take to all the Medicaid plans. And they're bipartisan, they work for both parties in all states, but they really want something in this space that they can bring forward to make a difference in all the Medicaid programs. So we have a chance to influence and steer and guide and mentor the world a little bit right now in this space, regardless of who wins. So that's going to be interesting time. So with that as kind of a context piece, take it away.
Okay, Alex.
Thank you. Fascinating times indeed, George. Good afternoon, commissioners. I am mindful of our hard stop at 3 p.m., so I'm going to try to make this brief, but Sharna and I are happy to answer any questions at the end of the presentation or offline. So when we last presented the legislative item to you in April, it was only a few weeks after the state of emergency had been issued. So at that time, so much was unknown. So now, as we enter the last week and a half of the legislative session, the state has fully shifted focus to COVID response and recovery. Starting with legislation, Attachment A provides a list of First 5 California's Level 1 priority bills currently moving through the legislative process. As you will notice, this list is significantly shorter than it has been in previous years, as lawmakers were asked to limit their bill packages this year to focus on urgent COVID needs, as well as other priority issue areas, including wildfires and housing. So as the regular legislative session comes to a close on August 31st, there remains the possibility of a special session or multiple special sessions on specific issue areas if the legislature feels there are unresolved items that need urgent attention. At this time, however, there are no special sessions scheduled. On June 29th, Governor Newsom signed a $202 billion budget for the 2020-21 fiscal year. Overall, the budget avoids many deep cuts proposed in the May revision through revenue deferrals, lower caseload projections, and use of reserve funding. Without additional COVID relief funds from the federal government, leaders in California agreed to include certain trigger cuts in the approved budget, which will occur if more federal money does not materialize. Depending on the total amount provided, receiving further stimulus from Congress would avert some or all trigger cuts. The final California budget determined an October 15th, 2020 deadline for federal funds to avert those proposed trigger cuts. A full overview of budget actions is included in your item, but one item I want to highlight in particular is the paid family leave job protection proposal that was included as part of the budget deal. If you'll recall, this is the proposal that was born out of the governor's paid family leave task force recommendations that would provide universal job protection for employees accessing family leave benefits. While the proposal was included in the budget deal, it is now moving as a legislative vehicle through the legislative process and has been amended to increase the employee threshold for job protection from 1 employee to 5. First 5 California has been actively engaged in the proposal as a member of the Paid Family Leave Task Force, alongside our California Work and Family Coalition and task force partners. In addition to a legislative strategy, First 5 California has been assisting with the deployment of a social and paid media strategy as we work to make this critical policy a law. We expect SB 1383 to come up for its final vote in the legislature in the next week. As we close out this year and begin to look to next, we'll continue to focus on early literacy priorities and lifting up child outcomes to the administration and legislature, and look forward to supporting and acting on the priorities identified in the master plan for early learning and care. On the federal front, while COVID-19 relief negotiations appear to be stalled for the time being, yesterday Senate Republicans introduced a new COVID-19 relief proposal, the Delivering Immediate Relief to America's Families, Schools, and Small Businesses Act, also known as the Skinny proposal. Coming in at just under $500 billion, this is a narrower version of the HEALS Act, which was proposed by Senate Republicans in late July. In response, House Democrats are expected to introduce their own narrower bill in the coming days. While the House is scheduled to return to session this week to vote on Democrats' Postal Service bill, a final COVID deal is likely still a few weeks away. All relief proposals currently on the table, however, the HEROES Act passed by House Democrats, the HEALS Act passed by Senate Republicans, and now the new Skinny proposal introduced by Senate Republicans, unfortunately all fall short of meeting the immense childcare needs across the country. In response to these unmet needs, lawmakers have introduced legislation to raise the high water mark for childcare funding from $7 billion to $50 billion. This legislation passed out of the House with bipartisan support and will strengthen Democrats' negotiating position as the next COVID response package is deliberated. With the understanding that much of what happens at the state level will depend on the amount of federal relief states receive, First Fives have deepened our federal engagement, deploying a strategy that focuses on educating policymakers of the essential infrastructure of child-serving systems. With more and more opportunities for federal engagement ahead of us, First Five California is preparing to release a federal advocacy RFP to expand our capacity to engage in Washington on behalf of the entire First Five network and in support of the state administration's priorities. Using previous commission discussions on what a First Five federal engagement strategy should look like as a guide, we will be fleshing out a scope of work over the next month for discussion at the October commission meeting. So with that, I will stop there, and Sharon and I are happy to answer any questions.
Thank you. Good information. Any questions? Comments, questions? We're going to be a lot smarter after the November election about where things are going to go. Both parties are going to decide what they want to do. Right now, it's still all political, and so we don't know which direction they're going to go, and they will both have to make decisions about future of COVID funding and all of the other budget areas once they figure out who's actually going to be in all those key jobs. And right now, it's we're doing exactly the right thing to get from moment to moment to moment, bill to bill to bill, and get to that point. And then after that, we're going to have to, there will be a trajectory in my own sense. I've been spending a lot of time with the scientists on this who are looking at the vaccines and the treatments and the approaches that they're going to use. And they are, there's a likelihood that we will have treatments that will be supported by artificial intelligence that will actually be much more effective in the treatment of the disease, but the likelihood of getting everybody sufficiently vaccinated to create a critical mass is going to be logistically really, really hard. And so we're likely to be in difficulty for a very long time. And quite a number of settings are going to try to create herd immunity about just letting people get sick, and particularly letting the kids get sick. And it depends on the red blue state kind of model, but they assume that the kids are going to survive. All of their rhetoric is about kids don't die anyway, they just get it. And so they're going to try to build a herd immunity model. It's rather than a vaccine herd immunity model. So we really don't know, but what we do know is it's going to take a very long time to get out of this. And there isn't any ray of sunshine that's going to happen at the beginning of next year that's going to make anything easy. And since it's not going to get easy, we have to assume that it's going to stay hard. So I have seen some really amazing improvements in care. They now identify very early. It's all comorbidities that are killing people. And the African American death rate, when you factor out comorbidities, just becomes zero. There is no difference on the death rate when you take out the comorbidities, but when you put the comorbidities in, it's huge. And each of them has a different outcome, and then each of them requires a different treatment, and each of them requires a different response. And so you have to figure out as early as you can on each path what the issue is. If the issue is diabetes, you have to figure out as early as possible that this is a diabetic patient, and then intervene with the responses that save diabetics. And when you do that, you can get down to the ICU mortality rate dropping to under 15% if you get the early intervention model. So the whole country is moving in those directions, but not in an organized way for a while yet. Anyway, I'll stop talking about that. But what we can assume is that it's not going to get easy. So with that, great. Commission, any other comments or questions? Yes.
Thanks, Alex, for that overview. I have a question with regard to the transition of early childhood programs from Department of Education to Department of Social Services. While it's not the creation of the Department of Early Childhood Development that many of us were hoping for, it is a step in the direction of breaking down silos between health and education, or between health and early learning. And I know that transition won't happen until early 2021, but curious what sort of conversations you've been involved in, or First Five has been involved in, to ensure that in that transition and in that creation of a real child focus in the Department of Social Services, that deputy position, just the opportunity for First Five to be better integrated and have a more coordinated approach to a whole child, whole family framework, hopefully not only at social services, but across the board.
That is a great question. And I know Camille's been having regular conversations with Kim Johnson, so I will turn that to you, Camille.
So that's what I was going to say, is that we have been in conversation with Kim, not only briefing her on the work that First Five California is doing, talking with her and bringing her up to speed on Quality Counts California. We have another meeting scheduled with Kim, the Department of Education, and us to talk about that work together. Again, to offer support, talk to her about how we can be, support the transition, what information is needed, where opportunities lie. So we are in constant conversation, actually, Myra, with Kim and her team as she goes forward, with this transition, and also with Sarah on the Department of Ed side to figure out state preschool is going to stay there. So what does that mean, and how is the work still coordinated yet maybe separated in some ways? So we are looking at that. So can I just are there any other questions? Sorry, I didn't mean to.
No.
I'm so excited. I'm so excited. Commissioners, great job. We are like really right before 3 o'clock. So thank you so much for sticking with this and getting us to arrive at, what do you need?
I want to get a motion to adjourn. I want to officially end the meeting rather than just.
Yes, absolutely.
Nobody make a motion to adjourn the meeting? Nobody will? Please?
Is there a motion to adjourn?
Please.
Oh, Monica raised her hand.
Is there a second?
Somebody raise that hand?
Second.
You guys want to keep? Okay, moved in second.
Okay, here's wait. Here's the problem.
Yeah.
The problem was that Camille was talking, and then we seemed to be adjourning, and I thought, well, wait a minute, shouldn't Camille finish, or are her remarks going to be discussion upon the motion to adjourn? Was that what we're going to do?
Yes, I'm absolutely sorry. Now that I've got the motion, I'm totally secure, and back to Camille.
Okay, go ahead.
Yes.
Oh, thank you, Molly. Thanks, George. And I was just going to say, I know that you know, taking on George's remarks, how hard this is going to be. I just want to remind us what we heard about today. We went forward, commissioners, with approving funding for our next media outreach campaign, which we know will be a big part of the work we do. We heard about shared services. We moved money. There's some good stuff there. And most of all, we heard from Child Trends on home visiting and from the counties about the work. So with this very hard environment we find ourselves in, there is some sunshine there. So let's not forget that and celebrate those things as well as we move forward. So, and with that, I'm going to say we see you in October. Okay.
Well, I'm still going to call for the vote. All in favor of adjourning, say aye.
Yes.
Aye. Okay, we are adjourned. And Camille, really great meeting. Well done.
Yeah, great meeting, everybody. Bye-bye.
Great meeting.
Thank you. Bye-bye.